The webinar will begin shortly. Please remain on the line. The broadcast is now starting. All attendees are in listen-only mode.
Good evening and welcome to the Town of Merrimack PFAS informational meeting. Thank you for taking the time to join us tonight, and I want to thank the Town of Merrimack for helping us coordinate this informational meeting for its residents. Before we get started, I want to go through a few housekeeping items. Tonight, this meeting is being recorded. All attendees have been muted upon entry and will be muted throughout the presentation. If you're having any technical difficulties with the platform, with the GoToWebinar, please reach out to Mary Butow. That's Mary, M-A-R-Y .Butow, B-U-T-O-W @des.nh.gov. Or you can call her at 603-271-8693. Some handouts have been included in your dashboard. This includes the presentation slides as well as some informational items. And then tomorrow, everyone will receive a follow-up email. And in this email is going to be a Dropbox link. And that link will bring you to all of the handouts that are in the dashboard tonight, as well as some additional information and the recording of this video. We will be entertaining questions at the end of the presentation. We do want to let you know that if you are a call-in participant, you are in listen-only mode, and you will not be able to communicate with the panel, so you will not be able to ask your question live. We are going to ask that you use the question function to get into the question queue at the end. That function has currently been turned off, but at the end of the presentation, Erin Holmes is going to turn it back on and go through how you can ask your question. So tonight, I have with me Mike Wimsatt, Director Mike Wimsatt. He is the Director of the Waste Management Division. He is going to go through some background on PFAS and the DES's approach to the PFAS issue. And then we're going to move to Kathy Beam with the Air Resources Division, and she's going to talk about the air emissions and the control equipment installation. And then Jeff Martz from the Hazardous Waste Remediation Bureau is going to go through the investigation piece, some standards and sample results. And then Brandon Kernan from the Drinking Water and Groundwater Bureau is going to give an update on public water supplies in Merrimack. We are then going to take a 5-minute break, so you have a chance, to get some coffee, stretch your legs, and then we will go into the second half of the presentation, where Dr. Jonathan Ali is going to go through some of the health effects of PFAS. And then we're going to bring Brandon back, and he's going to go through some treatment options for homeowners. And then we'll move into our question and answer session. And during this period, we're also going to have Amy Doherty available to answer questions about anything that's outside of the consent decree. So Jeff is going to be able to answer questions inside the consent decree, and Amy Doherty will be able to answer some questions for you outside of the consent decree. All right, and with that, I am going to turn it over to Mike Wimsatt.
Thank you, Amy. So good evening, everyone. I want to thank everybody for participating and thank the officials from the Town of Merrimack for sort of hosting us virtually here this evening. What we really want to do is focus on the issues that are specific to your community in Merrimack tonight and answer your questions. But before we do that, we also want to make sure that everyone kind of has a basic knowledge of what PFAS are and how the contamination situation in your community has occurred and how we got to where we are today. So my job tonight is really just to spend a few minutes on kind of bringing everybody up to a basic level of understanding of the situation and where we are today. So what are PFAS? So PFAS, and I'm sure that many of the folks on this are very familiar with this term, but in the case some aren't. Per and polyfluoroalkyl substances, or PFAS, are basically synthetic organic compounds that contain multiple fluorine atoms. That's the most basic definition. They're generally carbon chains that have fluorine attached to the carbons. The two most studied are perfluorooctanoic acid, or PFOA, and that's the primary contaminant that we're dealing with in southern New Hampshire as a result of emissions from the St. Gobain facility in Merrimack. The second one most studied is the perfluorooctane sulfonate, or PFOS, and that we'll talk about what kind of products those are associated with in just a moment. But I want to talk about the fact that while we regulate only 4 of these compounds right now, this is really a family of thousands of diverse compounds, we're learning more and more about those compounds as time goes on, and we are sampling for and looking for a larger number of compounds than just the ones that we regulate when we sample. So the best way to understand the terminology here is to look at the PFAS tree and the family tree, if you will. And if you look at the apple that sort of fell from the tree on the ground here, PFC, that's the term back in 2016 that we were really using, and that stands for perfluorochemicals. And actually, PFOA and PFOS are both members of that perfluorochemical or perfluoroalkyls family. So it wasn't inaccurate, but it's not as inclusive, because when we talk about these compounds and some of their precursors, some of them are polyfluoroalkyl, which means they don't have a fluorine atom on every single bonding site on the carbons. That's the only difference. That's the reason. That's what a per means. And a poly means it has a lot of fluorines, but not as many as it could have, if you will. So that gives you an idea, and I want you to know that we're really going to use PFAS as a general term here. That's the term that most people across the country are using now. So I just wanted to help draw the distinction between those two terms. So these compounds were, again, they're synthetic, they're totally man-made, they do not occur in nature, and they were developed in the late 1940s. And they have a very specific, a bunch of properties, but one particular property that makes them very unique and also very useful for so many applied uses. And that is that the same molecule can both repel water and repel grease and oil. And that particular characteristic makes them useful in so many different products. And the ones that, that we're very familiar with is, Teflon cookware and Gore-Tex coated rain gear and things like that. But as you can see, they're just used in so many different commercial and retail products. Any one of us has come into contact with all or any of these particular kinds of materials. And the one that we're going to focus on tonight, the PFOA, among many other uses, in this particular case at St. Gobain, it's used to coat textiles. And Jeff Martz is going to tell you a little bit more about that later tonight. But that's down here on this list of industrial uses, textiles. That's really what is happening in large part at St. Gobain, and that's the application that these compounds are being used in. So the discovery, just to give you a little background on the discovery, and I'm sure many on this call are all too familiar with what happened. In 2016, the St. Gobain facility sampled water coming into their facility, actually from the MVD local water supply. And the reason they sampled is that they had facilities in New York State and in Vermont that actually had used these compounds, and they had already discovered very recently at that time that they had groundwater and drinking water contamination with PFOA. So knowing that they were conducting the same kind of manufacturing operations in Merrimack, they elected to sample the water coming into the facility just to check it. And lo and behold, they did find that the water coming into the facility had about 30 parts per trillion of PFOA detected in it. And again, that was from the MVD supplied water. So that was reported to us, and that resulted in immediate steps on our part to sample public and private drinking water supplies in the vicinity of the plant. That grew very quickly to a point where everywhere we looked, we found it. And then eventually we looked across the river in Litchfield, and we found it there in both shallow and deep groundwater. And that really made it clear to us that this was not a conventional release to the formation where it's just something spilled in the ground and it gets into the groundwater and migrates to a drinking water well. This was an airborne transport pathway that had the ability to transport a lot of material much for greater distances and impact a lot more groundwater than what we would call a conventional release. So the testing expanded very rapidly. We identified impacts in 6 different towns in southern New Hampshire that we've associated with the facility's emissions. And those impacts included both public and private drinking water wells, and they included public and private drinking water wells right here in Merrimack. a little bit of a delay sometimes. So the incident response that we undertook was basically kind of a massive outreach and sampling effort. We had staff. It was an all hands on deck situation. We had staff going out and knocking on doors. We were using our GIS capabilities. We were using mailings and telephone to really identify and sample as many private drinking water wells as we could. And as we did that, we were doing that weekends and nights and really just a full court press to get as much sampling as we could. We quickly, determined we had a lot of people whose supplied water for their private well was impacted. So the short-term solution for that was to bring in bottled water. And we required St. Gobain to provide and pay for bottled water provision for people who were over the standard that we were applying at the time. And then it was clear that the long-term solution, bottled water is not a long-term solution, that would be some kind of alternate water. And as it turned out, in many cases, that was extension of existing public water systems to these private well owners' homes, or in some cases where that was not practicable, point of entry treatment systems for those homes. So that response really ended up being a very large scale bunch of water line projects in Merrimack, Litchfield, Bedford, and Manchester, where we extended water to everybody under an agreement that we made with St. Gobain. St. Gobain conducted these projects, did the design, and constructed these major water line extensions to, I think it was originally about 700 homes. And then, so those have been completed, that initial group of work, but we've continued, and they have continued to do sampling, and there's alternate water planning still ongoing in many communities, including Merrimack. So just to give you an idea, I've talked about standards without mentioning any numbers here. So at the time we first discovered this problem, we really didn't have any kind of enforceable standard. We had some health advisories from EPA that were much higher numbers. We knew that New York State had applied 100 part per trillion standard, and they had a few months of lead time for us. So we used that as kind of a target number for a while. But we also knew that EPA had been working hard on developing lifetime health advisory numbers for PFOA and PFOS. And while those wouldn't be enforceable standards at the federal level, they were really based on a good review of the science. And so we encouraged them to complete that work. And in April, they basically announced a 70 part per trillion lifetime health advisory for either PFOA or PFOS, or the two in combination. And so we immediately underwent emergency rulemaking to adopt that as an enforceable ambient groundwater quality standard in New Hampshire, which allowed us to use that as a target for compelling St. Gobain to both sample and provide alternate water for folks who were above that number. So at the same time, we knew there was a lot of new science going on, and time was marching on. And the legislature directed us to take a look at the science and develop standards for actually 4 compounds, including PFOA and PFOS. And we did that, and we issued a rulemaking that became effective September 30th of 2019, which established not only ambient groundwater quality standards, but a drinking water maximum contaminant level for these compounds. That was a very short-lived standard because the very next day, 3M Corporation, the Plymouth Village Water District, and some other parties filed a lawsuit against the state seeking a preliminary and a permanent injunction to bar us from enforcing the standard. That went through the Merrimack County Superior Court pretty quickly, and as of December 31st of that year, a preliminary injunction was granted, and so we were barred from enforcing the standard. The legislature took action and then made those very same standards effective as a matter of law, which basically mooted the lawsuit. And so effective July 2020 on the governor's signature, House Bill 1264 established those PFAS MCLs and the ambient groundwater quality standards as a matter of state law. And so those numbers, which you'll see a few times tonight, are for PFOA. That's probably the one that's of most interest in southern New Hampshire. That standard was significantly reduced from 70 parts per trillion to 12 parts per trillion. And then these other standards you see for the 3 compounds. So important to understand that the MCLs are applicable to regulated public water systems, and the ambient groundwater quality standards are applicable really across the board. When we are dealing with a contaminated site, we can use that number to compel a responsible party who has impacted someone's well to both sample and address any exceedances in that well. So that was a really important enforceable standard to have. So I want to talk a little bit about the consent decree that we entered into the St. Gobain. And keep in mind, back in 2017, 2018, we were working very hard looking to get the company to agree to design and construct water line extensions to hundreds of property owners in the 5-town area. And as part of that, we had to enter into an agreement with them. And basically at the time, we were working with a 70 part per trillion standard. So we looked at our modeling, we looked at what we thought was, a reasonable boundaries to draw on things. And we established 2 boundaries. So if in this chart here, you'll see the facility is right in the center where the arrow is. And then there's a red line, sort of an odd shape around that. That's called a preliminary groundwater management zone. Now, a groundwater management zone is a term that we use to describe basically all the groundwater at a contaminated site that is impacted above standards. We knew we didn't have anywhere near enough information to draw that line. So that's why it's called a pre-GMZ. The idea was that the sampling we had done to date showed us that pretty much anywhere we looked inside that red line, we were very likely to see groundwater impacted above 70 parts per trillion. So that was established as a pre-GMZ in the agreement. And then if you look at the outer line, the blue line, that is what we call the consent decree outer boundary. That is an area where basically we retain all our rights for enforcement inside that, but then there's some limitations on what St. Gobain needs to do outside the blue line. And I want to talk about that a little bit. So basically the pre-GMZ, we knew that we had significant impacts inside that, and pretty much everywhere inside there where there was an exceedance, the agreement outlined that St. Gobain was to construct and provide alternate drinking water, and in most cases that was indeed extension of existing public water systems. Now in the area outside the outer boundary, so outside the blue line, basically their responsibilities would continue, but only to the extent that there were impacts to groundwater or drinking water that were over 70 parts per trillion. So if there were impacts below 70 parts per trillion, we could not compel them to do work to address that outside the blue line. Now, if you think of the donut between the red and the blue line, that area, the state retains all its authorities between those 2 lines. So while the agreement didn't necessarily require, we knew we had further sampling to do. And as that sampling developed, we would be in a position to both require St. Gobain to do that sampling, but also to require them to address any impacts outside the boundary or within that area that were over the standard. And we know that in Merrimack, and this is no secret to folks on this call, I'm sure, that there are impacts to drinking water both inside and outside the CD outer boundary. And we'll talk a little bit about how we're going to address those. So again, this is a little repetitive for what I just said, but it gives you in words so you can refer to it later in the slide that basically what happens inside the outer boundary and what happens outside the outer boundary. And we're working to collect and evaluate data and develop solutions for impacts that are outside the outer boundary, as we are not able to compel St. Gobain to do that. And with that, I want to turn it over to Kathy Beam, Administrator within our Air Resources Division, to talk about the air emissions issue and the control equipment installation at the facility. Kathy?
Thank you, Mike. As Mike said, I work in the Air Resources Division, and I've been involved with this project since the water was first detected to have PFAS compounds in it in 2016. What I'd like to do tonight is just give you an overview of basically the air impacts in the area, and more importantly, what the most recent developments have been in terms of installing controls for the facility. There we go. So, as many of you are aware, St. Gobain is a facility that coats textiles with materials, and within those coatings that are put on that material is or used to be perfluor or octanoic acid or PFOA. They had emissions from the facility for many years and operated there in Merrimack, first as ChemFab and now as St. Gobain. The way that the facility operates is that these coatings are put into a dip pan, and these large rolls of textiles are dipped into the pan and then go up through what are called towers that have heating areas. where they drive off both the water and some of the chemicals in order to make their final coated products. What happens is those chemicals oftentimes will go through the stack and out into the atmosphere, where they'll later deposit either as wet deposition in the form of rain or snow, or dry deposition in terms of particles that would land on the ground and then through time would leach into the soil and down into the groundwater and be picked up by wells in the area. So in the case of St. Gobain, this is a graphic of the PFOA emissions that were estimated to have come from the facility since the time that ChemFAT first operated at the facility in 1986. As you can see, as time went on, more towers were added to the facility up until about 2000, when St. Gobain purchased the facility and transferred much of their tower operations from Vermont here to Merrimack. In 2004, 2005 timeframe, they did some stack testing when testing became available to look for emissions from the facility, and they discovered that the emissions of PFOA were high enough to be determined to not comply with the ambient air limits that are set by the state air toxics regulations. So we have regulations within the state that deal with the inhalation of compounds, and PFOA happened to be one of the many hundreds of compounds that is on that list. And at that time, the department issued a consent decree to the facility to mandate that they reformulate their raw materials and reduce the concentration of what is basically the ammonia salt of PFOA that was in their coatings at the time. That reformulation reduced PFOA emissions by about 96% back in 2006, 2007. So that's sort of the history of the PFOA emissions from the facility. What that ultimately resulted in, though, was the contamination that we're seeing as a result of air deposition. So between the time that the water was sampled in 2016 and 2018, there was a lot of sampling going on, data that was being collected from the raw materials, stack testing, collection of raw material, of stack residuals and dust in the windowsills in the localized area. And all of that data was combined together. And in 2018, the new statute that dealt with these PFCs at the time, that was what the term was called, that when coming out of a facility, those air emissions that actually impact soil and groundwater to the point that they cause an exceedance of a groundwater quality standard are subject to the requirement to put on best available control technology. So that law did not come into effect in New Hampshire until September 2018. But that same month, because of all of the data we had collected over the last 2 years at that time, the department sent a letter to St. Gobain notifying them formally that they were subject to that law. That set in motion a series of events that is outlined here. So the law requires that when a facility is notified that they're subject, they have 6 months to submit a permit application for control equipment to be installed and to analyze what that control technology should be. So they submitted an application in February of 2019, and the department reviewed that application, did extensive emission calculations, and reviewed control technology options and information. And in September of that year, we solicited public comments on a draft permit that went out for the public to review. We conducted a public hearing, and we got a large number of comments from the public, which was then incorporated and reviewed, and in the final permit for installation of what's considered a best available control technology, which was a regenerative thermal oxidizer. That permit was issued in February of 2020. So under the state law and that permit, the facility is required to install that control equipment by February of 2021. And if you've been watching the news, you probably have heard that equipment was not installed as of February of this year. So at that time, the state had a lawsuit asking for a preliminary and permanent injunction on the facility because of the failure to meet that deadline. And subsequently, the state and St. Gobain signed a consent decree to address the fact that they missed the deadline. And before I go into what the consent decree says, I just want to point out that additional information about what the control equipment is, what it is designed to do, what the permit requires, can be found at the link at the bottom of this page. So the 2021 consent decree that the Department and State entered into with St. Gobain requires that the facility install the air pollution control equipment by July 30th of this year. In addition to that, there are a number of requirements above and beyond what the permit required when it was issued, and that includes St. Gobain is limited in the hours of operation that they can operate between now and between when they didn't install the controls and when they do, to make sure that they are getting at least a 42% reduction from the PFOA emission levels that were measured in 2018. They're also required to complete a material balance to update their air toxics review for a compound called hydrogen fluoride, which is a compound that will be generated in the thermal oxidizer as a result of destroying the PFAS compounds. That initially was done using stack test information. We've asked that in this consent decree that they get better information about what's in their raw materials and to do a material balance of the fluoride atoms. Then the consent decree also requires some enhanced stack testing above and beyond what's already in the permit, and that'll take place after the controls are up and operational. St. Gobain's also required to do a 1-year rainwater study, collecting water samples on property as well as in 2 other locations off property. And they were also required to pay a civil penalty. And for more information on the consent decree and to actually see the consent decree, you can go to this link as well. And with that, I will turn it over to Jeff Martz.
Thank you, Kathy, and welcome everyone tonight. Thanks again for joining us. My name is Jeff Martz. I'm a senior hydrogeologist with NHDES's Hazardous Waste Remediation Bureau. The Hazardous Waste Remediation Bureau is the part of DES that is tasked with providing regulatory oversight of the investigation and remediation of PFAS contaminated sites. So for my part of the talk tonight, I'm going to talk about PFAS sites in sampling and PFAS occurrence, and I'll talk a little bit about the notification and alternate water programs. So I'm going to talk primarily about St. Gobain tonight, but I also want to point out that there are what we refer to as discrete PFAS sites. Mike Wimsatt mentioned conventional releases, and these include spills that might occur to the ground, leaks from landfill liners, or other small sites that generally have a relatively limited impact when we're comparing it to the context of the broader aerial deposition of PFAS as associated with the St. Gobain site. So this is a map showing the town of Merrimack. It's outlined in yellow. I put a blue shading over the surrounding towns to draw your eye to Merrimack. And it shows the 2 different lines from the 2018 consent decree. For the remainder of my talk, I'm going to refer to the 2018 consent decree just to distinguish that from the 2021 consent decree that Kathy just described. And also want to point out that there are a number of other discrete PFAS sites denoted by these pink stars located throughout the town of Merrimack. I'll draw your attention to the St. Gobain facility. Again, it's up in the northeast corner of Merrimack. Then we have the pre-GMZ is shown as this red line. So that's the area where primarily waterline extensions occurred under the 2018 consent decree. And then again, the blue outer boundary that Mike Wimsatt described. Also want to point out the Merrimack landfill, and I'll talk a little bit about some sampling that's going on in that area. And again, Amy Doherty will be available if there are any questions pertaining to any of these discrete sites. So again, I'm the project manager for St. Gobain, and each of these discrete sites, typically they have a project manager assigned, and they fall under Amy Doherty's supervision as the state site supervisor for the Hazardous Waste Remediation Bureau. So just again, this is a recap of the slide that Kathy showed. So again, we have air emissions from the facility being transported with wind, where PFAS are deposited either as rainfall or as dry deposition on the ground, leaching into the ground, working its way through the soil with subsequent rain events to the point where it gets dissolved in the groundwater and it can be withdrawn into water supply wells. I'm going to talk a lot more about the process of how it's moving into water supply wells and what we're seeing in terms of PFAS sampling results. So there are 5 primary sources of PFAS sampling data in Merrimack. First, the Gobain is responsible for evaluating the extent of ambient groundwater quality violations inside the consent decree due to discharges from its facility. When the standards were lowered from 70 parts per trillion for PFOA to the current standard of 12 parts per trillion originally in September 2019, Gobain submitted a work plan to identify affected wells. Subsequent to that initial work plan, 8 separate addenda have been submitted to DES, each listing new rounds of wells to be sampled, and a 9th addenda is expected at the end of the month, which is rapidly approaching. I also want to point out that Gobain's environmental consultant, Golder Associates, submits biweekly updates and bi-monthly reports to NHDES, and these are available for public viewing on DES's one-stop website. A second source of sampling data is sampling conducted by NHDES. Primarily that is from locations outside the consent decree. And DES is prioritizing its sampling based on potential risk of groundwater contamination and is currently focused on sampling, notification sampling. DES is required under state law to notify properties within 500 feet of an ambient groundwater quality exceeds. So DES's sampling crews are prioritizing areas within 500 feet of those exceedances in the area outside the consent decree. A number of wells have also recently been sampled in the Merrimack landfill area. This is, again, an area that's outside the consent decree. In the general location of the Merrimack landfill, there's been a number of wells that have been sampled in that area. And finally, a subset of wells are being sampled within a half-mile beyond the consent decree boundary, so just outside that blue line. A subset of wells are being sampled for PFAS. A third source of PFAS data is from residents who self-sample and provide the results. Really important if you have results that are above standard to provide those to DES so we can follow up with notifications and investigation of those occurrences. The discrete release sites, many of the ones that I showed on the map that have responsible parties, the responsible parties are required to conduct ongoing monitoring of on-site monitoring wells, and if there are any impacted water supply wells, they'd be sampled as well by the responsible parties, and reports would be submitted to DES, which again would be available on our one-stop website. And finally, the 5th source of PFAS sampling data in the town of Merrimack is from the public water supply, primarily the MVD water system, and I believe Brandon's going to talk about that later on tonight. So here's a map showing the groundwater sample results for PFOA. And for the remainder of my talk, I'm going to focus primarily on PFOA because that is the one of the 4 compounds that we regulate that is primarily driving exceedance for PFAS in the southern New Hampshire area and Merrimack in particular. So I'll call your attention to the color ramp down at the bottom, and I'll use this throughout my talk for each of the slides DES has generated, and I do have some images that were generated from Golder Associates reports to DES, so those are Gobain's consultant, and they have a slightly different color scheme. But I'm going to primarily be using green dots to represent concentrations of PFOA that are between 0 and 6 parts per trillion, so about 50% of the ambient groundwater quality standard. 6 to 9 is yellow, 9 to 12 is orange, and anything that's over our current standard of 12 parts per trillion is represented by a red dot. And finally, anything that's over the previous standard of 70 parts per trillion is colored purple. So if you look at the map to the right-hand side, I've illustrated roads that have existing water lines with a green shading. And drawing your attention to the PFAS results, most of the PFAS results in Merrimack that are over 70 parts per trillion in water supply wells are located within the pre-GMZ area outlined in red, so up in the northeast part of Merrimack. There are a few exceedances at discrete sites in town where we have levels above 70 parts per trillion, but generally these are monitoring wells or localized and extent. Looking elsewhere in the pre-GMZ or the consent decree boundary, we do have some wells that are over 12 parts per trillion. So throughout the town of Merrimack, approximately 474 wells have been sampled. 288 of those are inside the consent decree, and 186 are outside the consent decree. And of the 474 wells that have been sampled, approximately 256 of those samples exceed ambient groundwater quality standard for one or more PFAS. And 193 of those are inside the consent decree, and about 63 are outside the consent decree. I also want to point out that of the 193 that are inside the consent decree, the majority of those are in the pre-GMZ boundary and have been previously addressed by the extension of public water. And as of one of the most recent submittals from Golder Associates, approximately 20 wells in Merrimack, or residents with wells in Merrimack that are over standard, are being offered bottled water as part of the ongoing sampling and alternative water program. So now we're going to drill down into St. Gobain's sampling program. This is primarily occurring inside the consent decree area. And the small map on the right-hand side shows the entire 64-mile extent of the St. Gobain outer consent decree boundary area. This involves, 5 or 6 towns. And the blow-up in the middle is the Merrimack portion of that. And this is a very busy map, but I want to call out some important colors. The green color that Golder is using in this image indicates that they've confirmed the property has been connected to public water. The light blue coloring indicates that a parcel is located near a water line, but a connection has not been confirmed, although Golder terms that as suspected or likely. And then I want to point out this sort of pink or lavender color that indicates through the and they use a different color scheme. Anything that's green is less than the standard. Anything that's yellow is over standard. And I often get asked the question, why was my property selected for sampling? And in the case of Merrimack, there's 2 primary reasons properties were selected for sampling. The first being a proximity to a known ambient groundwater quality exceedance. So when a known exceedance is detected, surrounding properties are identified for additional sampling by Golder Associates in subsequent addenda. In some of the more recent addenda, St. Gobain has identified neighborhood scale sampling where they're trying to fill out and complete the data set for entire neighborhoods. So that's indicated by this blue hatched color here. So in the case of when a water sample tests above ambient groundwater quality standards, St. Gobain is responsible for providing alternate water. And in the short run, that alternate water is taking the form of bottled water that they are providing via Monadnock spring water. And in the long run, they're required to develop a plan to permanently address each of the affected wells that's above standard. So that's something that they're currently working on. So when a well tests above standard, Golder Associates completes a packet that's mailed or FedEx to each resident who's had their well sampled, and it includes several things. One, it'll include a complete copy of the lab report, which is about 20 pages. It'll include a table that Golder put together summarizing the lab results on a single page, and I'll show an example of that later on in my talk, and a cover letter from Golder. And in the event that that water sample tested above standard, there will be a letter like the one I'm showing on the right side of the screen on St. Gobain letterhead with the title Eligibility to Receive Bottled Water. And I've highlighted in yellow where you can contact Monadnock Springs. If it's got a phone number there, you can reach out to the contact and arrange the delivery of bottled water to an affected residence. So I asked St. Gobain to provide a little more detail on how this bottled water program is working. And they provided this slide. I haven't changed it other than to note that it's from them. So when a well is determined to be above standard, Golder provides letters to the property owners, as I just described, as well as copies to Monadnock Springs. Then the property owner, should they decide to accept the offer of bottled water, contacts Monadnock Springs to coordinate delivery, set up routine delivery dates and amounts of water. And St. Gobain is asking that the property owner monitors the inventory and notifies Monadnock Springs 2 to 3 weeks before additional water is needed. And finally, St. Gobain is asking the property owners to make sure that all occupants of an affected property where a well is located and it's over standard be notified that the bottled water is being made available. And this would be most important to advise any tenants or any other people that might be living in the house so they're aware to use the bottled water for drinking and cooking. So what we're finding as we analyze the data that's coming in is that there's a very complex distribution of PFAS in groundwater when you look at a map view, such that when you drill down to the neighborhood scale, many times we find that an individual well could be below standard, but be located 10 or 20 feet from a well that is above standard. So two neighboring wells can have very different concentrations of PFOA. And, you know, there's several reasons that I think are driving this complexity. And the first being the air deposition and variations of the air deposition over the area that's under investigation. So the yellow to purple colored map in the upper left is a colored contoured air model that DES did for PFOA. So this is the modeled PFOA deposition that occurred or has been modeled to have occurred within the study area. And the yellow indicates areas where greater amounts of PFOA have been deposited, and this is generally closer to the facility. And as you move further away and you get into the cooler colors, the reds and on into purple, lesser amounts of PFOA have been deposited. And I'll just note that there are some localized effects such as topography and primary wind directions that affect the amount of air deposition at different scales. Another major factor in the distribution of PFAS in groundwater is the surficial geology. And thousands of years ago, when the glaciers were moving across New Hampshire and then retreating as the climate warmed, a variety of different deposits were laid down on the ground. These include glacial till, sand and gravel deposits where we find aquifers, lake bed deposits, which are finer grain and silty. And the reason this is important with respect to PFAS is that certain PFAS chemicals have different properties where they want to stick to sediments, and the type of sediments are thought to play a role, as well as some other characteristics. And the glacial geology is pretty complex in Meredith and Merrimack, and we believe that this results in some of the complex map patterns that we see in town. Another major factor is the bedrock geology, and I'll discuss that on my next slide. And finally, I want to point out time-related factors are also thought to play a role, and this would include changes in the chemicals released over time. If you recall Kathy's slide, she showed how reformulation occurred and the amount of PFOA emitted from the facility is been thought to have decreased substantially in the mid-2000s. It also includes factors such as precursor transformation, which are bigger molecules that break down into the 4 compounds that we regulate, as well as seasonal variation. So drilling back to the question of why do neighboring wells have very different concentrations of PFOA? So to try and answer this question, I've developed this cross-section or profile view that's looking down into the earth, and I've got 3 example wells. I've got a well on the right that is what we call a shallow overburden well. It could be referred to as a dug well or a driven well. And these wells all have a screen that's in the soil layer, which I've shown as this sort of brown stippled pattern here. And they get shallow water from the shallow overburden aquifer. And I want to call out that I'm using the same color scheme here for PFOA that I described earlier. So green is for concentrations of PFOA in groundwater that are less than 50%. Anything that's red is over the standard. And these downward red arrows represent air deposition and infiltrating shallow groundwater that is above the standard for PFOA. So in the case of this shallow overburden well, we have a relatively short flow path where infiltrating water reaches the well screen and is pumped out and is above standard, similar to the concentration as it infiltrates through the ground. But in the case of this center well, which is a bedrock well, and a bedrock well is drilled by installing a steel casing that extends from the ground surface a short way into rock, and then the well is drilled beyond the casing as an open rock hole until a series of water-bearing fractures are encountered, such as the one shown in this picture on the left-hand side. This was a photo taken with a downhole video camera, and it shows actual water from a water-bearing fracture flowing into a well. So, if you were to go into the well, you might find something like that. So in the case of this middle well, the example here, we have infiltrating water that's above the standard of PFOA, and it's working through a thick column of soil. And as I mentioned earlier, there's a tendency for some PFAS to stick to the soil to some degree. So in this example, by the time the water works its way all the way through the soil, it's below the standard for PFOA, between 9 and 12 parts per trillion, where it works its way through the first fracture that the well encountered. In this example, there's also a deeper fracture that has a concentration of PFOA that's much lower, less than 50% of the ambient groundwater quality standard. And when the well pump turns on, water mixes from these 2 different fractures, and the resulting concentration in this example is between 6 and 9 parts per trillion. Now I have a third well on the left-hand side, and this well is located in an area where we have very thin soil cover, so there's limited opportunity for the PFAS to sorb to the soil or stick to the soil. So the concentration of PFOA in the water that's entering the fractured rock is above standard, and when the well pump turns on, that water that's above standard is pumped out into the residence. So now I'm going to talk a little bit about the notification program. So as I mentioned earlier, under state rules, DES is required to notify property owners that are located within 500 feet of a well that exceeds the ambient groundwater quality standards for the 4 PFAS that we regulate, as well as other contaminants. So these are 2 different example letters. We have one that's tailored to the specifics of inside the consent decree, where St. Gobain is expected to do the sampling, and we have one that's tailored to outside the consent decree. And what both of these letters have in common is that they include contact information if you would like to have your well sampled. It gives you instructions on who to contact or how to reach out and request sampling of your well. Here is an example lab report summary. So this is the summary table that I mentioned that Golder Associates sends out with their packages for the sampling that they're doing on behalf of St. Gobain. So they've condensed the 20 pages of lab data onto a single table. And I know there's a lot to unpack here, and I'm going to try and boil it down. The 4 compounds that we regulate, I've highlighted in yellow. And the first one here, the acronym, it's easier to say the acronym is PFOA. And you scroll across to the right to the units. The units are nanograms per liter, which is equivalent to parts per trillion in water. And then the next column here is the ambient groundwater quality standard. I've circled that in blue. And in the case of PFOA, the standard is 12 parts per trillion. So working your way over to the right, the next column is the result column. So these are the actual concentrations that the laboratory measured in this example water sample. So in this case, the result for PFOA is 66 parts per trillion, or nanograms per liter, which is greater than 12. So this would indicate that there is a violation of ambient groundwater quality standards for PFOA. Now, the next compound that we regulate, PFNA, has a standard of 11 parts per trillion. And the notation here is a little different. It has 0.47 and then the letter U. And what this indicates is that the laboratories have a method detection limit, or the minimum amount of a compound they can reliably detect. And in this case, it's 0.47 parts per trillion. And the U indicates that they couldn't measure anything above 0.47. So in other words, this sample was non-detect, or PFNA was not detected, and the minimum that could have been detected was 0.47. So something less than 0.47 is in this well. Could be 0, or could be something less than 0.47. So here's another lab report. I know some people have their own wells tested and they get a lab report back from the lab. So there's not necessarily a clean table summarizing the results, but the labs often report the results, and they may or may not include the ambient groundwater quality standards, so you'd have to look those up on the DES website or refer back to the video of this presentation. But again, in this example, PFOA is listed here. It's at 14.4 parts per trillion. So again, that's over the standard of 12 parts per trillion. So this is another ambient groundwater quality violation. And PFNA in this instance was ND, which stands for not detected. So instead of the U after a number notation on the previous example, this lab simply states ND for not detect. So moving on to my last slide, I just want to point out the PFAS investigation webpage. There's a wealth of information here on the Gobain project in particular and PFAS in general. And I'll call your attention to the header up at the top here. There's drop-down menus. The PFAS in drinking water has information on private well testing, the NHDES private well testing form, PFAS treatment technology. So if you're interested in learning more about the technology that Brandon's going to talk about, you can go here for a fact sheet. There's also an interactive map and data tab, which pulls up a map viewer so you can view results from your neighborhood. You can type in your address and search for your location. There's also a frequently asked questions. You can also scroll down to sign up for email alerts for new blog posts. And you can't see the blog posts on the screenshot I provided here, but if you scroll down, there's a series of blog posts that chronicle major events in the PFAS investigation and the Gobain project. So with that, I'm going to turn it over to Brandon Kernan. Thank you.
All right, just 1 minute. I'm trying to get the screen to forward. Amy, can you go ahead and advance it for me, please? Thank you. So, good evening. I'm Brandon Kernan. I'm the administrator of the Drinking Water and Groundwater Bureau, and I'm going to give you an update on the public water supply in Merrimack, which is essentially only MVD. So first of all, I want to go over the results for PFOA sampling going back to 2016. This is a graph that's taken from the water system's website. They have a lot of information about their efforts to address the PFOA contamination. And it's really a good resource if you want additional information. But this is a result plotting PFOA going back to 2016. You'll see on the left-hand side early on, the sampling data was pretty sporadic. And that had to do with it kind of being a new test for labs at the time, and even at the federal level, EPA having some uncertainty in how some aspects of the analytical method had to be interpreted by labs. And so that got straightened out, and then you can see the data going forward for 2016 is somewhat consistent. What this graph shows is the results from 3 areas of water supply in Merrimack. Merrimack, the village district, gets its water from 6 wells, essentially in 4 areas, and I'll show the 4th area in a minute. But for this graph, you see the results for well 2, which is the blue line, which recently, since 2020 or so has been generally just below the MCL of 12 parts per trillion for PFOA. It was higher in prior years, but it's had a downward trend recently and then stabilized around the standard. The results for well 3 have been consistently above 12, around 20 parts per trillion. And the results for well 7 and 8, which are very close to one another near the Hollis Merrimack town line, have been consistently from 20 to 30 parts per trillion. And so on this graph, you'll see results separately for wells 7 and 8, and then you'll also see the results for the combined water from those wells after it goes through the treatment plant. And there's an iron and manganese treatment plant at that site. I just want to talk about wells 4 and 5. These wells had the highest levels of PFOA and were taken offline in 2016 when it was clear that they were above the EPA's health advisory and then our initial standard of 70 parts per trillion. And so these results show wells 4 and 5 back in 2016 before it was taken offline. And then you see a span for these 2 wells where no data was collected as these wells were physically deactivated. And then you can see some recent data for the wells prior to treatment. The important thing is in 2020, treatment was installed. And so this is raw water, not what's going in the water system. And so after treatment was installed and the wells were reactivated in October 2020, the PFAS results from 4 and 5 are consistently non-detect now. PFOA is not detected. And so I don't have a graph showing zeros. It's just their routine sampling is showing that the treatment system's been quite effective. Just to give you a sense of where Merrimack Village District's been getting its water from recently, we just provide a summary of water use statistics that the water system reports to the state. And this is based on total monthly usage for January, February, and March. And you can see that they're definitely using the wells that are brought back online with treatment, wells 4 and 5, to the extent possible. And that is the majority of the water going into the system. So again, the treatment system is very effective, and PFOA has been non-detect. After that, they've been using well 2A. That's the well that's been recently just around the standard and slightly below our standard 12 per trillion. So that's been the second water source that they've relied upon the most. And then wells 7 and 8 have been used to some degree. But you'll see on the right-hand side the status of the system, and Merrimack has plans to put treatment in for all of its water sources. And so wells 4 and 5 are done. Later this year, it's expected that wells 7 and 8 will have treatment installed in October. And then next year, it's anticipated that wells 2 and 3 will also have treatment installed, with well 3 having a replacement well at a slightly different location. Also installed to replace that existing well. So within a year and a half, it looks like all water will be treated by MVD, and again, the treatment appears to be very effective. I just want to point out, there's MVD, in addition to having all their water quality testing results on their website, has a very good summary memo that talks about the capital improvements they're making on their water system to address this contamination. It was last updated in April by their Underwood engineers. And so if you want more detail on what's going into the treatment and the technology and the status, that information's in a very easy to read memo with informative graphics. And with that, we're going to take a 5-minute break before we start with Dr. Ali.
All right, we're going to take a 5-minute break so everyone can get up, get some coffee, stretch your legs. But I do need to apologize. I introduced everybody but myself to you. So quickly, I'm Amy Rousseau. I'm the PFAS Response Administrator for the DES. So I oversee some of the PFAS initiatives as far as research and investigation, and I administer some of the PFAS specific funding that we have available. So we will start our 5-minute break now. And so in 5 minutes, we will come back on and begin the second half of the presentation. All right. As soon as we have Dr. Ali back on the screen, we can move forward with the second half of the presentation. And there you are. You should have mouse and keyboard controls.
Okay, great. Thank you, Amy. Make sure the slides advance. There we go. Hi, everyone. My name is Dr. Jonathan Ali. I'm the toxicologist with the New Hampshire Department of Environmental Services, and I'm going to go over health risk and exposure concerns related to PFAS compounds. So to start with, I just want to let everyone know that I work for the State Department of Environmental Services, but within this role, we also collaborate with partners at the Department of Health and Human Services, including Division of Public Health Services, as well as federal partners at the Agency for Toxic Substances and Disease Registry. A couple months ago, I believe in December, we came out and gave a presentation about this collaboration and how some of its work can be used to help your community address concerns and also identify potential issues that maybe we could help with in the future. So to start with, our main concern for exposure to PFAS is through ingestion. So when we think about any chemical, its risk is usually driven by how we're exposed to it, how it can get into our body. Once it's in the body, that's where we have concern for it having some sort of activity that can cause harm. With PFAS, the primary source of exposure or the route of exposure that we're concerned with is through ingestion. So that can either be ingestion of drinking water or contaminated food items. A lot of research has gone into this, and this is actually how we understand a lot of exposure factors related to PFAS compounds. We also understand that exposure can occur in infants and fetuses where certain PFAS can transfer across the placenta into fetuses who are then born with PFAS in their body. And some of them can be transferred across in breast milk to breastfed infants. So again, that breastfeeding reiterates the risk for exposure from ingestion. There is some potential risk and some research going on right now trying to understand the risk from inhalation or partial ingestion of PFAS from dust. So at this time, a lot of the research is focused on inhalation risk related to dust that carry PFAS on them. So this could be dust from household products as they break down and if they contain PFAS or any kind of stain-resistant treatment. That dust can either be inhaled and gradually ingested, or for small infants and toddlers, if they're doing sort of hand crawling behaviors and then put those hands into their mouth, that's another way that those can be ingested. Right now, there's very limited research, but from what we understand, certain PFAS are poorly absorbed across the skin, and this includes long-chain PFAS like PFOA and PFOS. Some studies have found that exposure can occur across the skin, but it's at much higher concentrations than what we see in groundwater. And it's typically seen in situations where you have specifically foams developing, or in the case of firefighters, where they're actually interacting with AFFF or aqueous film forming foams. One of the biggest concerns about exposure is that certain PFAS are bioaccumulative. And this means that exposure to small amounts will build up over time because our body is very effective at retaining these chemicals within us. Some chemicals we can break down and eliminate from our body very quickly. PFAS is not amongst those. So for certain PFAS, they do accumulate very well in the body. Other PFAS, it appears they do not. So because of this, this is one of the reasons that we set these low standards for the long-chain PFAS that we're currently regulating, because evidence suggests that these are very bioaccumulative. So those standards are listed here, and this is just a reiteration of what Mike Wimsatt showed earlier. But one of the things to remember is that these limits were developed for the most sensitive segment of the population. So this is pregnant and lactating women in order to protect their infants, those same individuals who consume high volumes of water on a regular basis, and individuals with chronic exposure, or that would be using the water for a chronic period of time, so for several years to decades. And additionally, these standards are reduced lower than what they might be to account for sources of exposure other than drinking water. So things like commercial products that maybe we interact with that could have some exposure, household dust, and possibly some background contamination from certain food products that might also accumulate these chemicals. For more information about how these standards are derived and the science behind them, you can follow this link. I'm aware that this is sort of repetitious for several residents that are on this call today, as we're very interactive with Merrimack in the process, but for those that aren't familiar, we have additional information available. So there are some health risks that have been associated with PFAS, and this is still an evolving area of science. But some of the key health effects that have been identified and recognized by the Agency for Toxic Substances and Disease Registry include increases in cholesterol levels, changes in certain liver enzyme levels, slight changes to infant birth weight, some alterations to the immune system function, some risk of preeclampsia, changes in thyroid and reproductive hormones. So if you're thinking of thyroid hormone, but reproductive hormones include like testosterone and estrogen. And there have been some studies that have suggested a potential association to certain cancers, but this has usually been in populations with significantly high exposures. So these studies are currently always coming out every couple of weeks, every couple of months. We're seeing new studies that come out on PFAS and associated health effects. Some health effects, the evidence goes back and forth. Other ones it's strengthened, other ones not so much. This is something that us, federal partners, and other states continue to monitor. But additionally, ATSDR is currently undergoing a large nationwide study to try to understand what are the risks from exposure in communities that have had drinking water exposure. A lot of this has focused on communities with AFFF or aqueous film forming foam contamination. So what the goal of this being that in time, we'll actually look back, understand what the effects were, and be able to inform other communities that have had exposure through drinking water. This is constantly evolving area of research, but more information can be found at their website. You can also reach out to us and we're happy to connect you with information that we're seeing. So one of the things I wanted to take some time and do was answer some frequently asked questions that we're getting from a lot of community members, both in Merrimack and in other towns that have been impacted. One of the first things is, where can my physician learn more about PFAS and my family's risk? Understandably, there is frustration because physicians are not toxicologists. They're barely pharmacists half the time. So understanding the risk of chemicals to your health can be a tricky subject for them. There are some resources available at the New Hampshire Department of Health and Human Services website, as well as through the Agency for Toxic Substances and Disease Registry. If your physician's unfamiliar with these or they have some questions, either I or staff at DHHS can help them out. One of the things to remember, though, is this is also an evolving area of research and science. There is currently a national panel that's actually trying to understand if we can develop specific guidance for physicians related to evaluating risk from exposure and what that means for patients' clinical outcomes. Right now, the science is a little tenuous on that, and it's difficult for physicians to make those kind of calls and make changes to a patient's health or to their healthcare plans. This is constantly evolving. We're hoping that we'll get more information the next year. You've also had residents from your own community that have testified before these national panels, provide insights and perspectives. For that, we're grateful, but we're also keeping an eye on this to see how it changes. Another frequent question is there a test to measure PFAS in blood? And the answer is yes, but it's complicated. The same bill that was passed that codified our drinking water standards into law also required health insurance companies to pay for PFAS blood testing. If you go to a physician and ask for this, they may be unfamiliar with it, so you'll need to be patient. You also need to have a conversation with the physician to see if they're comfortable with ordering that kind of test. At this time, there's no determined level of PFAS in your blood that would trigger action by a physician other than to make the recommendation of test your well and try to reduce your exposure. So some physicians may not be comfortable with ordering a test without knowing a diagnostic value. That's a conversation to have with your physician. If they're wanting additional information, we have links available. They can also reach out to academic partners in the region. The poison control centers can also direct them to other information. So it is complicated. Testing is available, but it is a tricky subject, and it's a conversation you want to have directly with your primary care physician. So can I cook with the water? Is another common question that we're getting. And basically, if you're above the standards, we wouldn't recommend that you cook with the water. Boiling does not remove PFAS. You cannot cook these out of the water. And in fact, you may concentrate it somewhat into certain food products depending on what you're preparing with the water. Since ingestion is the primary route of exposure, you'll be increasing your overall exposure if you're using this to cook certain food items. Another question is about, can we use the water for bathing, showering, cleaning? Our standards are based on the use of water for ingestion, so use as drinking water. For these other levels or these other uses of water, no level has been determined for those. However, because of how poorly these are absorbed through skin, these are considered lower risk activities. So for these other purposes, and just bearing in mind that sometimes general cleaning products may contain certain PFAS items, most of the levels that we see in residential wells are not really considered a high risk activity for these uses. Another question is, can I irrigate my home garden that has fruits and vegetables using this water? Again, we reiterate, these standards are based on drinking water consumption. There's still very little that's understood about how PFAS are taken up by certain forms of plants. We do understand that plants interact with PFAS differently than animals do, and that makes it more complicated to give very concrete advice on, is a certain level in your well going to be safe for a certain plant that you're growing? There has been some attempt to understand this in studies around the world in their areas impacted by PFAS. But as Jeff Martz mentioned earlier, we do have an issue where soil type affects how these move. So depending on the interactions a certain PFAS compound or suite of compounds have with the soil, it may affect how well they're taken up by plants. And at this time, we don't have that information to make an accurate assessment. Similarly, can I irrigate the water with my lawn, or thinking about sort of skin contact if there's residues? Again, these are meant for drinking water standards, and due to the considered lower risk from the skin contact, it's not considered a major pathway of exposure. We also just remind people, if you're using any other kind of lawn care products, or if there's other irritants, such as noxious weeds, other items like that, you do want to be mindful of that and other things you might come in contact with in those settings. We also get questions about pets. There's still very little that's understood about how PFAS may affect pets, especially things like cats, dogs, and certain hobby fish. What we do understand, though, is, again, with most other animals, ingestion is the primary source of exposure. But we also understand that animals might get ingestion from a different way. So if you have treated fabrics, other materials, or dust in your household that contain PFAS, then pets may have exposure through that route as they go around, lay on objects, and groom themselves. For most aquatic species, there's not a lot of information, but the best place to start for any concerns related to your pet is having a conversation with your veterinarian about any health concerns you have. And if they are sure that it's not caused by something else, either in the environment, in the home, or just predisposed for that species. If you'd like extra information, or if your veterinarian like extra information, I'm happy to provide them with any studies that we have that be related to your concern. And you can use my contact information at the end of this presentation. And then finally, are there limits for other PFAS compounds? So depending on the estimate, you can have several, between 2,000 to 7,000, depending on which reference you use, but there's a lot of different kinds of PFAS that have been identified. We're not sure about how many are actually in the environment as testing methods keep changing, but right now I only have standards for 4 of these compounds, and that's based on the availability of evidence to determine that they do pose a risk. There are other compounds in the environment, and we're continuing to assess that information to see if we can improve risk assessment and provide that guidance. But at this time, we're working off of these 4 compounds to identify areas of risk. So just another resource I wanted to throw out there for everyone is our Apple Tree program. It's the world's longest acronym, and I'm sorry for that. But this program is specifically focused at addressing community concerns and helping them to reduce exposures. So we try to gather information, identify issues, and work with the community to identify solutions if possible. We have a great team that's working on this. They've recently started up in the last few months. We have a presentation we did for Merrimack that's available by recording. But if you have any additional questions about this program or how we can be of service, you can reach out to Karen Craver, who's our principal investigator, using the information below. Or if you forget that in the meantime, feel free to call me as well. And with that, that's my contact information, and I will hand it back over to Brandon Kernan.
All right. Sorry about that. So I'm going to speak about options for homeowners if they want to treat PFAS and remove it from their water. It's jumping around. Sorry about that. All right, here we go. First of all, if you are someone on a private well, we have recommendations for testing for PFAS and beyond PFAS. And we recommend that every private well owner sample for at least PFOA, PFOS, PFNA, and PFHXS. Those are the 4 PFAS analytes that we have standards for. But we also recommend that they test for other parameters that can be naturally occurring or come from other sources of contamination. Things like arsenic, which is naturally occurring, bacteria, which could be a sign of contamination from the surface or a leach field, chlorides, copper, fluoride, and hardness, iron, lead, manganese, nitrate, nitrite, and then right on is sodium and uranium. We have recommendations for sampling on our website at the link here, as well as labs that can complete the testing. And the list of labs include the state lab in Concord, as well as private labs, including labs in your area. If you do test your well, we recommend that you go to an application that the state's developed. It's called Be Well Informed. So if you just type NHDES or even New Hampshire and then Be Well Informed, you should readily find this website. And this application will look at your sampling results that you enter in and let you know where you stand relative to state and federal standards, as well as identifying the strategies for installing treatment and removing contaminants if you have contaminants that are approaching or above the standard. And it'll show you the sequence that the equipment should be installed to logically remove contaminants in a treatment train. And this is just a screenshot of the Be Well Informed application where you can enter in the results. And again, it has the list of laboratories and also our sampling recommendations. As far as PFAS treatment options, DES has developed a fact sheet for homeowners. And what it highlights is a couple of different approaches. One, you can take a point of use approach where it's a technology that could essentially go under the sink or could really go in the basement under the kitchen. And it would treat water that goes to a dedicated faucet in your kitchen. And you probably could split it off and also treat water that goes to your refrigerator as well in those cases. And if you do point of use, again, just treating the water at a dedicated location, there's a couple technologies. You can use reverse osmosis, which removes PFAS very effectively, as well as most of the other contaminants that I just mentioned before. The other option for that point of use, the dedicated faucet, is granular activated carbon. And there are units that have been shown to be very effective at removing PFAS to non-detectable levels. But sometimes if you go to the really small filters beyond treating a dedicated faucet, such as a water pitcher or a filter for refrigerator, studies have shown that those smaller filters can reduce PFAS, but less likely to be to non-detectable levels. And there's a lot of uncertainty and concern about how long those filters would be effective for. Another option for treating PFAS, though, if you want to go beyond dedicated faucet, is something we call a point of entry treatment. And for this, you pretty much would have to use granular activated carbon. And unlike the point of use where you can go to the big box stores or go online and readily buy them, the point of entry requires a little more plumbing and design, and it's not really an off-the-shelf product. You need to sort of buy the components and put it together. But there's a number of water treatment companies that have demonstrated expertise in doing that. It will remove the PFAS effectively from your water in your home, but it's unlikely it'll impact any other contaminants that I mentioned before. Carbon really doesn't treat treat those contaminants effectively, you'd have to add additional resin or treatment media. One concern about point of entry is you're treating a lot of water, essentially all the water in the home, because as the water comes into your basement, the water's being treated, is that if you have high radon in your water, that will be absorbed to the carbon, and you would need to make sure you're changing out the carbon frequently so you don't create radioactivity at the filter system. Again, as mentioned by Jeff, there's a number of links to resources, both what labs do testing for PFAS and the contact information, and even the out-of-state labs have good shipping options. We now have in-state labs, and most in-state labs work with partner labs to provide PFAS testing services, but they're all listed on that fact sheet. And we go over the treatment that I just described. And then there's also links to the National Sanitation Foundation, and where they have certified certain PFAS treatment equipment shown to be effective. And then also there's links to research that EPA and the state of Minnesota have completed on treatment systems, the type that I mentioned before, to show which ones have proven to be effective. And with that, I'll turn it back over to Aaron or Amy.
There we go. Thanks, Brandon, and thanks to all the presenters. So I am just going to wait until I have control of the control of this. Give me a second.
You should have control, Aaron.
No, I don't know why that just didn't work. So, okay. So thank you everybody for listening and hearing from the experts tonight. We are going to open the Q&A session, and what I'm going to do is just fast forward through the Q&A logistics and bring you right to the how-to screen. And so we are turning on the attendees can ask questions function. So for those of you who are on the computer, and again, I apologize to anybody on the phone, but we do not have any mechanism for incorporating you into this question and answer session. But again, all of the contacts will be sent out afterwards. All of the resources will be provided in a link that you can reach out to the particular people that you're trying to ask a question to. So I do apologize. So if you are an attendee and you do have a question, and you don't see something that looks like what I have shown right here, look for that little orange box with the white arrow and click on that. And that will open up what I call the dashboard. And then in that dashboard, you'll see that gray menu with a drop-down caret called the questions. And we're not asking you to write your question into that. We would just like you to put in your first and last name and your town of residence. And then that will send us your information, and you will be put in a queue. And once I get through these screens, you'll see actually a Word document come up on here, and we'll be maintaining that queue. So you'll see exactly where you are in the list for people to go next to ask a question. So I'll go over some ground rules really quickly, and then I'll show this slide again. For anybody who might want to be asked a question. And the team is hopefully taking a quick little break before we start the Q&A session. So I'm just going to go backwards. So again, using the Q&A function, DES will be monitoring that and will call upon each attendee in order it's received in the queue. You will be identified and unmuted and invited to ask your question to the panel. This is where it gets a little tricky. You would be muted by the organizer and you'll be muted by yourself. So you'll have to make sure that you unmute yourself. And in your dashboard, you should see a little microphone. And if you just move your mouse over that, it'll tell you if you're muted by yourself or if you're muted by the organizer. But we'll be monitoring that and we'll be unmuting you as you come up in the queue. And then, oops. When you are invited to speak, we are asking you to state your first and last name for the panel, and then you will be limited initially to about 3 minutes to ask your question. And that's just to accommodate everyone in the queue. What we are doing is, you can ask your question, the panel will answer the question, And then if you have any follow-up questions to that, feel free to go ahead and ask them. Obviously, we're here for you tonight, and we want to be able to answer as many questions that you have as possible. However, if you haven't asked your question and you're starting to go off on a tangent, we might just remind you to focus on the panel and ask your question to them. Just want to keep it moving so that everybody's questions get addressed. And then always, if you think of something after you've hung up with the panel, go back into the question box and add your name back into the queue. You can go back in as many times as you'd like. And again, we have a lot of resources in the handouts and contacts. So feel free to reach out to anybody if you think of a question after this. So I will just put up this screen for another few moments. And then when Jim is ready, we'll pull up the Word document. And so, Mary, are you?
Aaron,
Yeah?
you need to make me a presenter, I think.
Okay, I can do that. There you are. Yes. Okay, Jim, you should be able to share your screen. There you go. All right. And when the panel comes back from their break, they'll all be turning on their cameras, and then we'll know that they're ready to start the session. Amy Russo will be facilitating it and assisting the panel with who's answering the questions. So, hey, everybody. So Amy, with that, I am going to mute and monitor the questions.
Okay, thank you, Erin. All right, so let's jump right in and get started. So first in the queue is Carol DePiro. Erin, have you unmuted Carol?
I'm unmuted.
Yep. Okay.
Yep.
Yep, we can hear you.
My question is mostly about the air stacks. I know St. Gobain was ordered to put on all this equipment, and I know they have been using COVID as a delay tactic. And I'm wondering if we have an update on where that stands, seeing as it got into our water through the air.
Hi, Carol. This is Kathy Beam from the Air Division. I appreciate your question. The permit required that they install the control equipment by February of this year, and as you know, that was not the case. The consent decree that we just entered into with the company requires the installation by July 30th of this year.
Will there be any penalty for them being late?
So in addition to installing the control equipment, they have several different things that the consent decree added to the responsibility of the St. Gobain facility, including currently they're limiting their hours of operation so that their emissions for PFOA are at least 42% of the 2018 standards or 2018 emissions. They're doing a material balance to look at potential hydrogen fluoride that could be generated from the RTO. They're going to be doing enhanced stack testing. They have a rainwater study that they'll be conducting over the course of the next year, and there was a civil penalty associated with the consent decree.
Can I ask an additional question? I don't want to step on anybody else's toes. I know there's a queue building up.
Yeah, of course.
I'm just curious about the monitoring wells across from the farm stand near the new buildings, how high those are coming up. I know there are monitoring wells on that land that Flatley's looking to develop further.
Yeah, thanks. This is Jeff Martz. I know there's data available on One Stop, and I'm not exactly sure where the farm stand is located, but on that parcel that Flatley's developing, we have a range of values that are coming up in the monitoring wells. Generally, just under 1,000 to several thousand as you move around behind the facility towards the river. So several thousand parts per trillion in some of those wells, maybe 1,000 in others surrounding the facility for PFOA.
Wow. Yeah, the farm stand is directly across. They're pretty worried. Okay, thank you.
Thanks.
All right, thank you. Next in line is John Garuba.
Can you hear me now?
Yes.
Okay. I recently got a letter in the mail. I'm outside of Merrimack, but I figured I'd dial in and ask some questions here. I had a two-part question. John Ali talked about some of the concerns for buildup of PFAS over time in the human body, but I don't think I heard you describe what any of the negative effects are of that buildup, just that it did build up. So I'd like to understand if there are any known health consequences to that buildup over time at this point. And then I'd also like to understand, outside of the consent degree boundary with St. Gobain, where they're required to add or mitigate water, and a lot of the mitigation has been to increase public water supply availability. What about groups of residents that are outside of that? And is there any plan by the state or other organizations to increase public water supply in those areas? Okay.
John, if you want to take the first question, and then maybe Jeff or Mike take the second.
Yeah, sure. John, thanks for your question. So I did have a slide in there. I don't know if it cut out for a minute for you, but some of the health effects that have been associated with PFAS include things like increased cholesterol levels, certain liver enzyme levels that suggest liver toxicity, some alterations into the immune system, how it might function or respond to stressors. There's also been some studies that have shown effects on circulating thyroid hormones, as well as testosterone and estrogen levels. A lot of this depends on some other factors that might be going on in an individual. It also depends on sex and how long they've been exposed for. There's also been some evidence that suggested some changes in birth weight or some risk of hypertension for pregnant women. So a lot of these are related with chronic exposure to these compounds and building them up over time. And it's been populations that have been highly exposed where we've understood this. So our standards are based on trying to keep people below those levels of exposure that might be associated with those risks. Does that answer your question for my part before I hand it over?
That definitely helps. I'll take a look further at your references. It must have cut out like you suggested, because I did have some network connection problems. Thanks.
Okay. Yeah, no worries. And also the slides and handouts are there. So if you have any questions and if you want to get into the weeds about it, I'm happy to have a phone call with you and address any specific concerns you have. So thank you.
So, and I'll take a crack at the second part of your question, John. So, outside the consent decree, we do have, in Merrimack is not alone. We have in other towns, we have, in some cases, some pretty significant impacts that we believe are attributed to the site. And in those cases, we're working with local officials, and we're doing our own sampling to try to characterize that. And we will be working with communities to try to develop solutions for that. I'm happy to report that there's a lot of things in play right now. It's a little bit hard to talk about anything definitively because there are a number of potential funding sources that are very likely to be available for addressing PFAS, for addressing private wells that are impacted by PFAS, but they're still in process here. So those efforts are both in the New Hampshire legislature as well as in Congress, in the U.S. Congress. So I think there's going to be some substantial funding available to address those impacts. And right now we're really working hard, as Jeff has described in his presentation, to understand the extent of those and understand where they're sourced. And then we're going to be looking to develop solutions to make sure that people have access to safe alternate water.
All right.
Thank you.
Thanks. Thank you, John. All right. Next is Paul Squires.
Yes, good evening. Thank you for your time. John pretty much asked my question. We are just outside of the boundary area. Just got our well results back today. We were clear on the first round of testing a couple years ago, but with the change in levels, we are now in the unhappy zone, if you will. But it sounds like there may be, I will say, relief in the future for alternate water. since we're outside of the zone, I guess I can't call Monadnock and get bottled water delivered tomorrow.
Right. So yeah, we're absolutely working on solutions for that. I think that again, the horizon looks pretty good as far as having resources to address these issues. And we're going to be continuing to work very hard to figure out, first of all, what needs to be done, what's the most cost effective and frankly, effective from a safety standpoint of providing that alternate water, and then working to make sure we can find a way to finance it and do it.
Okay, thank you.
You're welcome.
All right. Jen Ladani.
Hi. Yes. So I actually moved to Gilbert Crossing back in March. I was told that we're not on a well, we're public water, but like where is the water being treated? That was my first question.
For
Brandon, go ahead.
so that
So yeah, my address is like 8 Gilbert Drive. I'm in the new apartment complexes. So my question is, how do I know where that water is being treated? Like if I wanted to look up that water quality report.
you can. So that development is on the Merrimack Village District water system. Their system extends for many, many miles, and each of the well sites is going to have treatment installed, as I explained earlier, and then their website even has a lot more detail. The treatment, when a water system treats, it's usually somewhere near proximity to where the wells are, or a point in between wells where raw water is pumped to that treatment center with no connections in between, and then the water is treated before it goes out in the distribution system and is provided to the public. And so if you want more information about the wells for Merrimack, including the status of construction, again, that memo from April prepared by Underwood for NVD is a very good summary of where it's at.
Okay. And then I had just one other kind of question here. So I had no idea that the water was this bad. I mean, I never got like a letter from the town. The John Flatley company never notified me. I mean, I don't know how many people don't know that the water's bad and are drinking it. I mean, fortunately for me, I did my research and I paid out of pocket to get the water tested and installed like a Culligan filter. So my levels are not detected at this point, but I'm concerned about everybody else in this complex.
So New Hampshire is a leader in adopting an enforceable drinking water standard. There's only a handful of states that have done this. And as Director Wimsatt explained earlier, we adopted it. There was initially a litigation that stalled our enforcement of the MCL. But once the water system collects 4 quarters of data and the average shows that they're violating our standard, there are public notification requirements. And so because Merrimack has some sources of water that may go beyond the 4 quarters, there will be notification. That would have occurred sooner had it not been for the litigation that stalled the implementation of the MCL.
Okay, thank you.
All right, thank you. Next is Wendy Thomas.
You're unmuted, Wendy. It says she's on web. I think that might be the issue of why she doesn't have any. Wendy, are you able to? Okay. So Wendy, whether maybe you don't have audio set up, if you're on your phone, maybe it's not working. But if you want to type your question into the question, oh, there it is. Okay, so I'll read Wendy's question. The information on, are you there, Wendy? Oh no. The information on pets was a little disconcerting. I've spoken to a lot of people who have pets with significant illnesses, kidney, cancer tumors, etc. Are there any plans for New Hampshire to test and or measure PFAS in domestic or farm animals? And the same question for PFAS chemicals found in produce, meat, milk, and eggs.
So John, do you want to go ahead and take that one?
Yeah, so I can start with addressing that concern about pets. It is a problem that we don't have a lot of animal data for cats and dogs. A lot of the research on PFAS is focused on rodents and specifically mouse and rat models that we understand how to translate that into human health risk. But we don't have a lot of research on how to translate that into animal risk for things like canines, felines, and some other species. So there could be some risk or some exposure for those animals. One of the things to bear in mind, though, is certain animals are just predisposed to, in general, certain types of cancers and certain types of diseases. And without having studies that can tease that apart, we might see an area where you could see things like kidney damage, kidney harm to an animal, but also if you have well water that has uranium or arsenic in it, we know that's also toxic to a lot of those animals, and it can specifically target the kidneys. So this time we don't have the information to really tease that apart. And as far as testing other livestock goes, it's difficult to say what the levels would be, and also just having that understanding of what risk there is. As far as actual activities going on around agriculture and those products, I would defer to Mike on any activities that are going on within the state related to that.
Sure. Thanks, John. So at present, I'm not aware of any plans on the part of DES or the Department of Agriculture in New Hampshire to test produce. We generally, our mission at DES is largely focused on drinking water. And that, of course, has been the predominant pathway of concern for exposure to these contaminants. So our efforts are really focused on. One of the challenges is that we don't, as Jonathan mentioned earlier, the research on the uptake by plants is really still emerging, and there are a lot of folks working on it. So we can continue to review the literature as it becomes available, but I'm not aware of any specific sampling of actual products here in New Hampshire that's planned at present.
Okay, I believe Don Preventer would like to comment as well. So if Aaron hasn't already, have you unmuted him, Aaron?
Yes, Don's unmuted.
Okay, you can go ahead, Don.
Thanks.
Yes.
Can everybody hear me?
We can.
Great. Yes, I just wanted to address Ms. Jen Landini's comment. Gilbert Crossing is in the northeast section of the town, and that was the area of town that was primarily served by MBD wells 4 and 5. Since October of last year, 2020, the treatment plant, the PFAS treatment plant for wells 4 and 5 has been online. And MVD has done testing up in that section of town, actually across the entire town's distribution system. And I'm pleased to say that that section of town, the results are indicated that their PFAS is non-detect in the MVD system. And that's primarily because wells 4 and 5 supply the water to that portion of the town. So the good news is Gilbert Crossing in that area, which was the most heavily impacted, being closest to the St. Gobain source in the past, is now actually the cleanest water in the MVD system. And as Brandon indicated before, we're on track to have all of our wells treated by summer of 2022. So I just wanted to make that clear. Thanks.
Thank you, Don. Aaron, I just want to make sure that Wendy Thomas had all of her questions addressed. Was there anything else from Wendy?
No, it doesn't look like it. She said thank you. Yeah, she just responded no. Thanks,
Okay,
Wendy.
perfect. All right, then we'll move to Kristen Ayers.
Hi, can you hear me?
Yes, we can.
Okay, thank you. I apologize I didn't put my town. This is Kristen Ayers from Merrimack. My question is regarding the fish testing that was ordered quite a few years ago by you guys to have St. Gobain have done, and it was never done. Well, it was done, but it was botched quite severely. So we are here without any of that data. So I just wanted to know, what is the status on that? Here we are quite a few years later with no information on the fish testing. So I don't know who can speak to that.
Do John or Mike? Or Jeff. Go ahead, Jeff.
I was going to start. I'll start and turn it over to some others. So Saint-Gobain was asked to do fish testing, and they were able to collect fish of target size from the Merrimack River. They were also asked to collect fish samples from Dumpling Brook. But at the time, the conditions were such in the brook that there were only little tiny fish that were not edible, and the guidance that Saint-Gobain was given was we wanted to get information on edible fish, so legally catchable size fillets, and they simply weren't present. Subsequently, there's been some additional work to evaluate fish statewide, and I don't know if John or Mike or someone else on the call can speak to that, but I think that data is important to provide context to the data from the Merrimack area as well.
Yeah, and I can just follow up on that. So the state has put some money behind doing some widespread testing in other water bodies. That way we can understand the context of where does Saint-Gobain's results fit in, where do other sites fit in that maybe there's contamination. We're still working through that data right now. There are some issues and differences in how we analyze fish tissue versus how we analyze water. For many of you that were with this investigation from the very start, you probably recall there's a lot of back and forth about can this method detect PFOA, PFOS, and other compounds at a certain level. Water is a much advanced stage versus fish tissue. So we're still working through some of that data, but we're hoping to have that within this year, and hopefully we can make that public and share that with people and understand what risk there might be to fish consumption.
Okay, so here we are. I mean, it was important enough to order this test by Saint-Gobain. So are you not making them do that now?
So the results from the fish from the Merrimack River had generally similar concentrations. It's been a little while since I've looked at the data, but generally
there
similar
were no
concentrations.
Because they didn't have enough fish. They collected tiny little fish that were not. I've read the results. They didn't have enough tissues for it to quantify anything. So
yeah, there were results from the Merrimack River, and those fish had similar results to previous studies that were done.
So maybe from the Merrimack River, I'm talking about the Dumpling Brook.
But Dumpling Brook, you are correct that the fish were simply too small.
And they had plenty of time to do that test because you extended it.
Yeah, and there were some technical reasons why that was extended, because we wanted to get a low water situation where water was flowing out from Dumpling Brook, because Dumpling Brook is primarily fed by groundwater. But when the stage of the Merrimack River, so the level in the Merrimack River,
because there was a beaver dam, I remember the whole thing.
Yeah,
I'm just wondering, are you going to make them do the test? Can we just find out? Are they going to do the test, and can we just get the results? Because we have people that fish, and I just want to know, is the test going to be done, and when will the test be done?
Yeah, we'll be reviewing the data that Jonathan mentioned is incoming from other areas. And
I mean, is a Merrimack test going to be done?
Kristen, can you let's let Jeff finish so what he's saying.
Yeah, so
yes or no?
We're going to be looking at the data that they did submit from the Merrimack fish, from the Merrimack River, the fish that were collected in the Merrimack River, and we'll be reviewing that data in the context of the sampling that's being done across the state, so we can see what those levels are with respect to other water bodies that are, less likely or not likely at all to have had impacts from Saint-Gobain.
Okay, let me ask this. Is there going to be the test that you ordered on Dumpling Brook? Let me just rephrase it then. Are you going to have that test done?
I would say at this point it's going to be contingent upon further review of the data.
So Kristen, part of the frustration, this happens sometimes, is that the biology doesn't cooperate with what we'd like to do. So the configuration of Dumpling Brook changed in a way that meant that it was really difficult to find fish of the appropriate size for testing. And that happens sometimes. And, we'll look at this, and if we determine that there are fish there because the configuration has changed and it's appropriate to test fish, and we can obtain fish appropriate size for testing, we'll certainly look at doing that. But at present, we don't have reason to believe that they would identify them. It's likely to say that
I'm sorry to cut you off. Keep going. I apologize.
It's likely that the fish that were caught in the Merrimack would be the sort of edible size fish that would end up in Dumpling Brook. And so that was probably at some level representative of what we might have found in Dumpling Brook. But, you know, again, we'll have to look at what has happened to the structure of the stream and what the conditions are. And if we find that the realistic expectation that fish of, you know, size are spending significant time in Dumpling Brook such that they could take up PFAS and be a concern, then we'll look at having that tested.
So all of this time is passing and we're just not going to have the data that is needed to get that information. I just think that's really sad.
Yeah, I understand. I think we've answered your question as best we can, and I have a feeling we're not going to satisfy you, but that's...
Okay. Can I ask one more thing? So Brandon, you mentioned that that there are small point of use filters that can reduce PFAS. And my question is, I'm concerned actually, it's not really a question, that people may hear something like that and just kind of think that maybe Brita filters might reduce PFAS. That's not what you meant, and I just want to clarify that. Is that what you meant?
You're correct. We don't necessarily recommend those small pitcher filters. We recommend a point of use, using some of the references that we point to that have been certified by NSF or that EPA or Minnesota has done research on. But the really small filters that you might use in your refrigerator or in a pitcher, while studies have shown they reduce PFAS, they're more likely to experience breakthrough and not have complete removal. And it's just not the assessment and sort of certification on those filters as much. So yeah, thanks for clarifying that.
All right, thank you. That's all.
Right. Thank you, Kristen, and thank you, Jeff, Brandon, and Mike. Let's move on to Ben Niles, please.
Yes, thank you very much. I want to thank the panel. I found this to be very informative. It's really my first deep exposure to PFAS because I kind of sat on the sidelines being on town water. A couple questions. Who would I contact at MVD that would be up to speed on PFAS if I have questions for them relative to what well I was on, et cetera?
So,
Brendan, is that something you would know?
So this is Mike Wimsatt. So I think, you know, Don Preventure is one of the commissioners that we have dealt with pretty extensively. And I know Don is on this call, and I'm sure you could reach out to him. And if he didn't know the answer to your question, I'm sure he could connect you with someone at MVD who would be able to answer your question.
Okay. Don Preventioner?
Preventure, Provencher.
Okay. Reason being is I've been a resident for 45 years in Merrimack and on town water, and you know, and prior to 2016 we had no standards, so whatever was, you know, floating around in the water, that's what I was exposed to. And so I want to just explore, you know, is there a long-term health risks that I've been exposed to over a period of 45 years.
Sure. Yeah. And this is one of the more frustrating questions that we've been asked about this. And it's frustrating because we really don't have the information we need to provide a good answer. What we can tell you very candidly is that either St. Gobain or its predecessor company at the site, ChemFab, has operated this kind of manufacturing operation that uses PFAS compounds since the mid-1980s. And we believe, every reason to believe there were air emissions, you know, as soon as that manufacturing began, and that those emissions would have continued throughout the period. What we don't know really well is what those levels were, you know, each from year to year, or for that matter, how long it took for those emissions to, you know, be dispersed on the winds and out and then leach down into groundwater. So we don't know when the first levels of PFAS would have been detected had we known to test for them over that time. So it's really hard to assess that. You know, it's probably safe to say that, you know, for some period of years before our discovery of this problem in 2016, groundwater and drinking water were contaminated throughout that area. And I'm sorry I don't have a better answer than that for you.
Okay, no, I understand. I understand. The other thing which I'd like to throw out for future consideration, if I may, and I'm not trying to be presumptive, I am not a scientist. I've had a career in business, not science and water treatment. But my understanding is that the treatment that MVD is doing is these large stack carbon filters in these huge steel vessels that they've put into existing buildings or added on to buildings, put new buildings up for them. And that captures the PFOA, but it doesn't eliminate it. So all we do is we move it out of the water into the carbon filter. It's still a hazardous element, a forever chemical. And so what that begs the question is, at some point, those filters have to be disposed of, and how's that going to be done without harming another area of the environment? Now, setting that aside for a moment, in what little I did on the internet prior to this meeting, there is a treatment which destroys the PFOAs called plasma reactor that the Air Force funded to Clarkson University professors, 2 of them, that set up a demonstration project that appears to be very successful. And I put that on the table because, in my opinion, granted I'm just a resident, not an expert, but in my opinion, the next step would be to move from carbon filters to plasma reactors. So I just want to throw that out there for what it's worth. And you know better than I what to do with that. And I thank you very much for your time.
Well, thank you for sharing that. And yeah, to the first of that part of the question, granulated activated carbon is a very time-tested, true, reliable way to treat drinking water on a plant scale for a public water system to make sure that it meets standards for certain compounds. It's very effective treatment of PFAS. And you're right, it does trap it and it doesn't destroy it. On that plant scale, those carbons would be periodically changed out. And what would likely happen is that carbon would go back to a regeneration facility where it would be heated to high temperature to desorb the PFAS, and that would be destroyed by incineration. So it's not perfect, but it's a pretty effective way to deal with it. So eventually the PFAS does get destroyed, that gets trapped by that carbon.
So it can be incinerated and there's no air pollution that pushes those chemicals into the air?
Well, I'm not prepared to have a discussion with you about the.
Well, when they say it's a forever chemical, the question is how do you then render it harmless? That's really what I'm driving at. I don't need to get into a lengthy discussion. I just want to put this on the table, food for thought, because I found it fascinating. Based on what little reading I did prior to this session tonight.
Sure, and I'm trying very much to agree with you. I mean, so we're aware that there are a number of technologies, and plasma reactor is one of them, that are being explored for this. And we expect that in the future, those kinds of technologies, maybe that one or maybe another one, may replace granulated activated carbon. But of course, as you can imagine, if you run a public water system, you don't want a treatment system that's in research and development. You want one that is time tested and true. So most, virtually all water systems are using either some kind of ion exchange resin or granulated activated carbon to treat PFAS, because they know at the end of the day that their water is going to be treated effectively. But you're absolutely right. I think there will be better technologies that will come available and that will become trustworthy and applicable at public water systems. So we look forward to that day.
Okay. Thank you very much for your time, sir.
Welcome. Thank you.
All right. Thank you, Ben. All right. Next, we have Representative Rung. Good evening.
Good evening. I want to thank everyone on the panel for contributing your time and talent tonight to address the concerns of Merrimack. I also want to just let the residents on the call know particularly Jen Landani from Gilbert's Crossing, Ben, Paul. If you have any questions or need any follow-up, please give me a call. My home number is 424-6664, along with other state representatives from Merrimack and our town council. We want to do whatever we can to address our residents' concerns. I also want to just give notice to any of the well owners in Merrimack who have received a letter from Golder Associates or from the town requesting permission to test their well water. Please participate in that program. It's very important. Again, if you have any questions, you can give me a call. Now my question for the panel is, what other PFAS, aside from those that are regulated, have been detected? And are they concerns from DES on these? I'm particularly interested because when you mentioned about the, maybe actually a follow-up question is, when you mentioned about seeking the mass balance of fluorine in the air emissions, is that going to give you information, or is Saint-Gobain helping you with information about other PFAS they may be using that aren't regulated? And one other follow-up question to that is, has Saint-Gobain indicated if they're going to install a hydrogen fluoride scrubber on the stacks? So hope I didn't confuse you all with those questions.
See if I can remember all the questions. Representative. Your first question was regarding the material balance and whether we were going to identify other PFAS compounds through that we may be of concern. Is that the correct?
Yes, because I know there's only 4 that are regulated, but I believe MVD is starting to see PFBA show up as a breakthrough in the activated, granulated activated carbon filters. So I'm wondering if other PFAS similar to PFBA are a concern to DES.
Well, in terms of whether it's a concern or not, I'll let someone else respond to that. But in terms of the material balance that we've asked Saint-Gobain to do under the consent decree, they are required to go back to their suppliers and first find out if they can get a total organic fluoride concentration, so we know how much fluoride is coming in, whether it's in various PFAS forms or not. Okay. is sort of a secondary situation. The response so far from the information we've received is that their vendors don't have that information because total organic fluoride is a difficult test to do on those particular compounds, the chemistry that's involved. So their second step would be to then get PFAS concentrations in their raw materials based on the basic sampling technology. I think it's 531. I'm not an expert on water testing, but anyway, there's a water test that has a list of the PFAS compounds that they would then be analyzing for. And if they can't detect it, they would use the detection levels to come up with how much fluoride would be coming through and creating HF. So will we be getting other PFAS compounds other than the standard list from this analysis? No. Its intention is to really get how much fluoride is coming into the facility from the raw materials to do an evaluation for the hydrogen fluoride potential emissions. And then I think your follow-up question to that is, are we going to require a scrubber? The consent decree requires that they look at the material balance, determine whether they have an issue with the ambient air standards that are related to hydrogen fluoride, and then if they do, propose what they would do to mitigate that. And that could be anything from putting on a scrubber to restricting operations so that they comply with those ambient air limits. It all depends on the results. And then finally, they will be stack testing once this equipment is up and running to confirm the hydrogen fluoride emissions. So there's a lot of levels of analysis in that regard.
All right. I just would like to ask DES to try to stay ahead of this, because there's a lot of new PFAS molecules that are outside the EPA standard method that are reaching the commercial market. And I don't want us to miss the boat and find in the future that those PFAS have been contaminating our groundwater, and yet we've missed the boat. You know, we're playing defense instead of offense. I think the mass balance will help, but it really isn't going to give us an indication of the organic structure or the nature of that chemical that's providing that fluoride contribution to the mass balance. But again, thank you very much. I appreciate all of your time tonight.
Does anybody want to address the PFBA question?
Yeah, thank you, Representative Rung. I really appreciate your comments on that. And I think one of the things that we have going for us in this process is that really from early on, we've been looking at and testing for a larger number of PFAS compounds than the 4 that we regulate, or the original 2 that we regulated. And that helps us. So then we understand, what's the occurrence. And at the end of the day, we're mostly concerned about an exposure pathway. And so to the extent that we're sampling a lot of drinking water, that really helps us to understand not only what's the presence of the regulated contaminants, but what else are we seeing there. And we are looking and reviewing and following the science as we understand, data is being developed on additional compounds that we don't currently regulate. We're looking at that. So I guess the general answer to are we concerned about other compounds is whatever we learn about compounds that are being detected, and then if we learn information about toxicology studies have been done to try to figure out what the risk of those compounds are. Those are the ones we're going to be most concerned about. And those are the ones we're going to follow the most. This is obviously going to be emerging for a long, long time. I will say a number of these compounds with shorter carbon chains, fortunately for all of us, tend to be less bioaccumulated. And as a result, they tend to have, if we were to set, as scientists look at potential early warning signals, or what would be an appropriate concentration where we'd be concerned, those shorter chain compounds tend to have higher numbers for that. And in most cases, we're not seeing those kinds of concentrations when we do see those other compounds in drinking water. But we're going to continue to monitor that, and I think that's going to be a topic of discussion and probably regulatory action in the coming years.
All right. Thank you very much, Mr. Wimsatt.
And if I could just add to that, MVD does test their wells more extensively than required, and they do opt for the longer list of analytes, and those results are posted. And I looked at the last few months for the treated water at the end of the whole treatment train, and it looks like the treatment plant is achieving non-detect, but you're right, PFBA would be probably the first one to break through, and it might be, and I haven't seen the midpoint treatment data. If they've sampled at that point, maybe it's breaking through part of the carbon before it gets all the way through. And to your point about other PFAS, in addition to what Director Wimsatt said, the states always lean very much forward and always have used analytical methods with the longest list of analytes. We've worked with the EPA to do non-targeted analysis, and we've even outreach to water systems, including MVD, about possibly using even some newer methods that look for up to 80 compounds and total organic fluorine, both treated and untreated. So we continue to try figuring out what we don't know. You're right, there's a lot to get a hold of here.
Thank you very much.
And if I could just follow up a little bit, EPA has come out with another test method 45, which has an extended list of analytes that can be analyzed through the stack test method that we didn't have available to us back in 2018. A lot of the stack testing we did back then was to help EPA to develop a test method. And then just a reminder that the thermal oxidizer is really designed to destroy the chemistry, and it doesn't really care what kind of standards you have. It's a kinetic reaction that's going to hopefully destroy the PFAS compounds of different chain lengths, regardless of whether we have a standard for them or not. So.
Yeah, that's true. That's true. Great. Thank you. And I'm glad there's a new method. Thank you.
Right. Thank you, Representative Rung. Next, we have Councilor Barbara Healy.
Hi there. Can you hear me?
Yes, we can.
Great. Good to see some of you who I've met before, and thank all of you for your time in holding these presentations for Merrimack and the surrounding towns. My question is more related to the rest of the story. So we already know our drinking water is being taken care of. We already know, based on the testing that Gobain has been doing for the last several years, that the groundwater is also testing with differing levels of PFAS depending on the well locations. So it's not a very hard guess to say that the surface water is also affected, although at this point in time we don't have the AGQS on those yet. So what happens going forward? Because even though they've got the RTO that's going to be controlling the air admissions, we still have contamination of the soil, of the groundwater, of the surface water, and all of that ultimately finds its way into the Merrimack River. So what happens there?
Mike, do you want to go ahead and take that one?
Sure. So yeah, it's a great question, and you're right. I mean, the way that the water cycle works, the groundwater, much of it will discharge to the Merrimack River, and surface water features will discharge to the Merrimack River. You know, and that's not a great story. That's what happens. That's what happens in every river system. You know, we are fortunate that, you know, the Merrimack River is monitored. It is used by a number of communities in New Hampshire and Massachusetts as a drinking water source. And we don't see levels, while we can detect PFAS in the Merrimack River water, we don't see levels that are, you know, that exceed or really even approach the standards that we've set for these compounds. So, you know, I think the key thing here is that we want to, with what Kathy Beam has been talking about, we're going to get controls on the facility to control for emissions. And then it's pretty hard on the scale that this has occurred to kind of get our arms around. You know, at a smaller site, we can, you know, potentially kind of create some kind of hydraulic barrier and pump and treat contaminated groundwater and remove the massive contamination from the system. It's just not practicable when you're talking about square miles, tens of square miles of impacted aquifer. So the reality is that, you know, that contaminated groundwater and surface waters will continue to discharge to the Merrimack River. We'll continue to monitor that and try to make sure we don't, you know, have facilities that are releasing any more or discharging any more. Try to get controls where we can to, you know, every gallon of MVD water that gets pumped and treated, that's PFAS that's removed from the system and taken off for destruction. So, you know, the good news is that I think we're going to be in a downward trend, but it's, you know, make no mistake, it's going to take many, many, many years to restore these aquifers to drinking water quality.
Okay, thank you so much.
You're welcome.
All right, Don would like to add to the discussion. Don, you're unmuted on our end.
Thank you. First, I'd like to thank everybody for being here this evening. I forgot to say that before. But I just wanted to address Representative Rung as far as the PFBA is the PFAS chemical that is ahead of all of other PFAS chemicals as far as passing down through the filter. So we have two filters at our Wells 4 and 5 treatment plant for MVD, and all the water goes through the lead filter, and then all the water goes through the lag filter, so they're in series. And each of those filters have sample ports at the 25, 50, and 75% depth level. So we started out monitoring the 25% level, and after a couple of months, we saw not breakthrough, but we saw detection of PFBA in that 25% sample tap. But again, the PFOA and all the other long chain compounds are easily or more easily absorbed by the carbon media. So they were not detected initially. The last I remember from last month, I believe PFBA was detected at the 50% sample tap. And to my recollection, I don't think anything had been detected. All PFAS compounds were still non-detect at the 75% sample tap depth. So there has been no breakthrough of the lead vessel yet, but as Representative Rung mentioned, PFBA is the one that's passing through the fastest, and it will break through first before all of the other compounds follow. But again, PFBA is not regulated, and that's one of the things that MDD is dealing with now, is to determine what the criteria is for when do we change those filter media out, depending on which PFAS compounds break through. So the latest sampling that's been detected, as I said before, in the northeast corner of the distribution system, which is served primarily by Wells 4 and 5, all PFAS are non-detect in the distribution system, and there is no PFAS coming through the lead vessel or the lag vessel at this point in time. So I just wanted to make that clear. It's good news, and we're continuing to track all that. Thanks.
Thank you, Don. All right, we're going to move on to Councilor Nancy Murphy. Good evening.
Thank you all for the presentation tonight, and your efforts to do this in all impacted communities. I know we're just one of here, I think in 3 or 4 now. I have 2 questions that I'll ask now, and then I'll get back in the queue because I just have a reminder about PFAS blood testing that I think we should probably just mention during this call. So my first question is in reference to something that Mike had addressed. It's regarding if subject wells that are being tested outside the CD area are found to be exceeding the MCLs, and I know you mentioned the DES is working on solutions. Since the CD won't allow St. Gobain to be held responsible, right? Essentially, even if it actually is, where will the funds come from or the resources to address whatever you have to do, whether it's bottled water or hookups? How is that going to work? I just don't. Taxpayers are asking, okay, we didn't do this, but where's the money going to come to fix it if it's outside the CD area?
Sure. Thank you. That's a great question. So, in essence, as I had mentioned before, there are legislative efforts to take federal monies that are coming from the American Recovery Plan and other federal sources, that some of which could be eligible for use to address PFAS problems. There are also has been previously amounts or sums of money appropriated by the legislature to loan money to water systems for treating their source water or expanding their systems to address contamination. And then there are a number of efforts in the U.S. Congress to establish programs that will actually help water systems and help communities. Some legislation that's specifically targeted at PFAS, and then other legislation that is more broadly targeted at improving drinking water infrastructure in the country. So, the short answer is that's all taxpayer money, because that's where all our money comes from in the government, right? So, but those are the efforts that are being made both at the state and federal level. There's also, and I should note that the Drinking Water and Groundwater Trust Fund, which was capitalized several years ago using funds from a jury verdict in the state's MTBE lawsuit against gasoline manufacturers. Those funds are also available, and community water systems, public water systems can apply for assistance from the trust fund to both in the form of grants and loans to address PFAS problems in their communities.
Thank you, Mike. I know that some of the concern that residents are having is certainly around the funds that they're loans, and so we're picking up the costs for increasing. We're paying for the warrant articles to filter our public wells, and then in other places. So we're picking up that too, and then if we want to get the money to water systems that are having to do that, then that's a loan. So we're getting stuck with that too. So I think that's the question. People are just asking, okay, if the polluter isn't going to be responsible, who's paying? And I think that's helpful. Thank you for that list.
And one more thing I'll add, I'm really glad you asked that question, because you're right. A lot of what's been provided to date or been made available is in the form of loans. But there are opportunities to get grants from the trust fund, and there are a lot of grant opportunities that are in play right now. And I say it's hard to, I can't make any promises on that because I certainly don't know what's going to happen in the New Hampshire legislature or in the U.S. Congress. But in both of those bodies, there's a lot of talk about making direct grant money or even loans with loan forgiveness, which is kind of another way of saying grant. That's in play, and we're following it very closely. We're working hard to assist and provide guidance wherever we can to help those programs so that they're tailored to really help folks like the people in Merrimack and the surrounding communities as effectively as possible.
Okay, one more quick one. What's the goal in terms of timeframes for entering the interim bottled water provision, or before it's connected over to alternate water sources? Is there like a time frame? I know this is a huge problem, but the time frames have been for some residents has been is really long. So I mean, is there a guidance time frame that okay, after a person's been, you know, we'll address an area that these people have been on the bottled water for a year and a half or whatever?
I think the short answer is we want people to be on a temporary fix like bottled water for as short a period of time as possible. Unfortunately, you know, it's been a long time for some people. And you know, we did have a number of people on bottled water for a few years from 2016 on that were over 70 before they got those water line extension projects completed and they were connected to the water lines. And now we're kind of having a second bout of that where, you know, we lowered the standard, and that standard didn't get lowered officially and enforceably until July of 2020. So about a year ago, and not quite a year ago. And now we're having people that we've sampled who are above that standard, who've been on bottled water now for, you know, coming on a year. And so that's not a great story. We don't like that. But the reality is that getting water lines built and people connected to water lines is really the best solution. But it's not, as often happens, the best solution is not the quickest. So it means that you've got to make sure you understand what the scope of your project's going to be, get it designed appropriately, not just for right now, but thinking about pipe sizing and all that for what you might have to do in the future, getting that design done, getting it out to bid, and then going to construction. So it's never as fast. Believe me, no one hates the delay more than the people at DES, but that's unfortunately the way that this has worked. And the good news is that at the end of the day, we do get a very good solution, but it often takes much longer than any of us would like.
Thank you.
Thank you, Councilor Murphy. Next, we have Kate Carlson.
Hi, yeah. So I live in North Nashua, pretty close to the Merrimack town line. But I'm actually an account manager for a landscape company, and I service properties from Wimsatt, New Hampshire, clear down to Worcester, Mass. And we do a lot of work with the Wildlife Habitat Council, so water quality is pretty important for us. I just have some more landscape-related questions, which you might not be able to answer very detailed, but do you guys foresee any regulations for herbicides and pesticides? Because I did notice they were on the list for PFA issues, as well as any potential irrigation regulations in the future, or any proactive measures that as a landscape company we can take to prevent further issues with PFOAs.
So, yeah, that's a great question. So, important to understand from a regulatory standpoint that the use and application of pesticides in New Hampshire is actually regulated by the Department of Agriculture, Food and Markets. That's New Hampshire's Department of Agriculture, basically. So while a lot of people think that DES has a key role in pesticide use, we don't. We don't actually regulate that. So I guess I would defer the question. I don't honestly know whether the Department of Agriculture or DAFM has the desire to, or any plans to do that with pesticides. We're generally aware that, Anvil, you've probably heard of pesticides that were stored in plastic containers that had fluorinated plastics. Some fluorine was detected and some PFAS were detected in those pesticides. That's something that folks are looking at. Obviously, some are looking at it and saying, well, you should be more concerned about the pesticide than however much residual fluorine there might be in it. But that's a discussion for another day. As far as irrigation water goes, we don't have any immediate plans to provide any regulatory framework for that. Obviously, we've answered some questions here tonight, people on a home scale looking at whether it's safe to water their lawns if they have PFAS in their water and such. One thing I will say that we are concerned about, and this is a broader issue, is that a lot of landscapers will use local surface waters to go and pump water into their trucks for, application of pesticides or whatever it is they might, or hydroseeding, or whatever they might be doing. And that, while that's lawful under certain circumstances, really should be understanding where they're going and what they're getting in their surface water, because we have had some concern that when you have a impacted surface water with a contaminant, someone going and pumping that water from the surface water and then applying it to someone's lawn may not be the most advisable thing. So I guess this is out of my area of expertise, but I would just note from my own knowledge of what we've heard about in the past that practice by landscapers is something that they should really take care about and make sure they understand what the general quality of the water they're getting from whatever surface water they happen to be pumping from.
Thank you.
Did I get to your question?
Yeah, I knew it wasn't going to be super detailed because there wasn't a lot of data on the landscape issue, but I figured I'd ask anyway.
Thank you, Kate. Carol DePiro, and you have another question?
Yeah, I do want to thank you all for taking the time tonight to talk with us. I realize these are difficult questions, but I actually wanted to make a statement to Jen Ladani, who lives at Gilbert Crossing. There were several of us in town that raised the question about building there because of the proximity to St. Gobain and the high level testing, and tried to make awareness. With that in mind, and the state, or at least the southern part of the state, sort of being in a drought, I'm concerned about further development in the town and that possibly leading to sooner breakthrough. We've been in touch with Pease and they saw GAC breakthrough sooner than they expected. And I'm concerned that we might be seeing with greater water usage, and if we just keep building. I don't know if you guys can express an opinion if you're allowed to. And then I had one other question.
So I can speak to the water system. I mean, Commissioner Preventure, of MVD spoke earlier about how they are tracking the efficiency of the filters and removing PFAS and how far it's getting through. And so they have a lot of safeguards in place. Not only do they have 2 filters, they're sampling throughout the filter system to see when breakthrough of the regulated or unregulated compounds are. And as he indicated, it'll be a decision for the commissioners to figure out when they want to change out the carbon. And so they can change it out if increased water use makes them be expended sooner. I will note MVD for a long time has been a leader in the state promoting conservation, from having the watering restrictions for outdoor lawn watering to messaging with the community. And then it's a well-run water system in that they ultimately have access to another source of water through Pennachuck Waterworks that has very low levels of PFAS in it, 2 to 4 parts per trillion. So they have options if they do have increased water use, but they're planning. I mean, they're putting in replacement wells, building treatment systems. They are on top of supply and demand and growth.
That's good to hear, but my understanding is it actually costs us when we buy water from Pennachuck, so I don't know if I'm real comfortable with that. But anyway, the other thing that concerns me is if we do use water quickly and there's breakthrough sooner, why are the Merrimack taxpayers on the hook for all of this and not the main polluting company?
Mike, do you want to go ahead and address that?
Sure. So that's a question that's been explored by MVD with DES. That's something that we are still working on. And I'll be candid with you. I don't think there's any comment I could make here that would be appropriate to make at this point. I think that this is something that MVD has raised with us, and we're looking at that. And there's some history there, but it's really a legal question that just wouldn't be appropriate for me to comment on in this setting.
Okay, thank you.
All right, thank you, Carol. Next we have Lorene Allen.
Am I unmuted?
Yes, you are. We can hear you.
Technology and myself are not friends. Thank you for this. A long night for all of you and for all of us. I have just 3 comments to make. One is I appreciate your comment letters back to St. Gobain on their work plans. I follow One Stop, as you know, pretty closely. And what bothers me is, back in April 1st, 2016, when you sent them a letter laying out what the expectation was for our community, when residents who were involved from the beginning, as many of us here are, read that letter, we said, wow, hey, that's what we need. They're on it. And we, for that year, even though we were trying to get our head around this, we took a little bit of a breath and said, all right, things are going to happen. Then in the 2 years after that, with all the mediation and, agreements and things that were going on, it didn't really play out that way. And I understand you're negotiating and trying to stay out of court. It's a very difficult situation. But 5 years later, we see the same pattern that you will put out very good information in responses to work plans. I think it was Jeff's response to St. Gobain in April of this year. So 5 years after that first DES letter. And basically, the gist of it for people on this call who aren't familiar with it is you're asking them to submit a plan for homes that exceed, the MCLs to provide both short and long-term solutions. And you're getting at in there this permanent solution. And I think your suggestion in that letter was they could then incorporate additional ID'd wells into the plan once they get it going. Because as Mike said, designing and figuring out where the pipes are going to go and all that underground stuff, yes, that doesn't happen overnight. So my worry, not just for the residents in Merrimack who've been receiving bottled water since 2019, that's for drinking water, that's a real hardship. They're stuck, in many, many ways with the stress of all this and the emotional burden. So the numbers in Londonderry and Bedford, and there's over 2,200 homes on the sampling plan. Then there's the folks outside the outer boundary that know their levels, and they're going, what are we supposed to do? And they're waiting for solutions. So St. Gobain hasn't really committed. I've asked them, and what I've heard is, we're just gathering the data, we'll talk to DES about that. So there's no commitment there. There's a lack of commitment. There's a lack of timeline. The most I've heard is they said that they'll be testing for the rest of this year. They recently submitted their annual testing and sampling work plan, earlier this in May. And basically it says at the end of it that we'll give you our next one in February of 2022. When I read that, I could just envision February 2022. They send you a big, long report that they pay a lot of money for those reports. And it basically says, this is how many homes we sampled. This is how many homes we're giving bottled water to. Here's the letters. It ends up like 847 pages, right? When they list all the letters and the water tests, and they put that all in a master document. So much time is being spent on these reports. The bi-weekly reports basically say the same thing. I read them when they come out twice a month, and it's the same numbers. They're not really making progress. So from our experience in this community, your experience is very different, but we see this, you're not dragging this out, they're dragging out. And I do understand corporate liability and all the reasons why they do that. But what we really need is we need a commitment. We need them to commit to you and to the state of New Hampshire and all these towns, at least to say, yes, we will connect these homes to a clean, safe water source. They haven't even said that, let alone the timeline. But this is what we really need, because the stress to families, I've talked to 5 families just in the last 2 days, and give them the information and the context and who they should call. And it's horrible, to hear this, and it must be really hard for you guys. So that's one piece about the lack of commitment. There needs to be a plan for these private well folks. It's just not acceptable. I did hear in the legislative body that they put an amendment into a bill recently that looked to take those federal funds that are coming our way. And I've done a lot of work with our federal delegation to try to get grant money, not, the revolving fund is great and the loans and the infrastructure. I know how that works, but grant money that can directly help private well owners in particular. So we'll have to do some work on this, because what I'm reading is, for some reason, there's been a proposal to stop grant money and to make all, funds loans. And there's a little bit about maybe there'll be some loan forgiveness. That's not okay. That's problematic. We're how many years into this? So we have some issues and big problems that we have to solve. Now, when we look at the MVD agreement, we all know in the beginning of this, you had told them what you expect. And then somewhere along the line, for whatever reason, MVD was kind of split off and had to do their own thing. So I understand what the issues are there, and yes, they made an agreement, but as a state, we have this thing called MCLs right now, and we need water to be safe and compliant. We know the responsible party, and the wells are within the GMZ, and they are not being held, to the same standards as the provisions that they would provide to private well owners, that if they couldn't be hooked up to private water, they would do POET systems, and they would need to make sure that that water was compliance. So what we've learned over the last 5 years is a lot. We've learned that GAC doesn't last forever. We've learned that, as Dawn talked about, the detection of the 25% and all of that at some point it's going to break through. We've learned that GAC is expensive, right, from the MVD engineers. We've learned that it's going to be replaced for years and years and years and decades. And the costs, since we started this, of everything, operation and maintenance costs have gone up, the cost of GAC has gone up, the cost of the engineers has gone up. That's what costs do. So we need some help here as to what's going to happen, because we have 4 more wells besides what the St. Gobain had funded, just the 5-year agreement. And the ratepayers are bearing millions and millions of dollars in remediation costs for what we did not cause. And we know those numbers from Brandon's presentation, and it's not okay. We have people all over town who are just, a lot of them won't even bother joining, calls like this, because they just go, they don't want to deal with the stress. They're not happy. They're disgusted. So, or private water from private wells, or public water, all groundwater, it's all contaminated. It's contaminated, through Londonderry, Bedford, Litchfield, on and on and on it goes. It goes beyond the lines, whether there's exemption areas that St. Gobain is not them, whether we agree or disagree, they haven't proved, who the other parties are. The emotional stress of this, I want you to please remember that. I know it's hard for all of you, but people here whose families, we don't bring health into it, because your job is exactly what it is. And on it goes. And my question that is on the minds of a lot of people is, when we talk about stopping the source and the site investigation on site, I'm wondering why other states, Hoosick Falls has handled this differently in New York. I believe even the Amherst site, there was a pre-CERCLA checklist filled out on that site. There's been a couple other ones. I'm curious why there hasn't ever been anything filed for federal cleanup on that site. And
Sure.
Why is that not identified as a contaminated site? Because it's a contaminated site.
Sure, that's a great question, Lorraine. Thank you for asking that. So, you may be aware that as far as federal sites go, that's what most people know of as a Superfund site or a National Priority List site. We have about 22 of those in New Hampshire. And that designation is generally applied for sites where there is not an expectation that the responsible party has the means or will cooperatively work to address the site. We have not sought to date a listing for that site because we do have a cooperative party. Now, obviously, you can differ on what level of cooperation there is. And I think going back to what you said earlier, you've heard me say in other settings that we have grown impatient on certain items that we've been looking for from St. Gobain, and we're actively engaged in pressing them on those. And I expect we're going to get some motion on that in the coming weeks. But in general, our experience with Superfund sites is that a cooperative responsible party working within the state cleanup system, state site cleanup system, is much speedier and more effective than a Superfund site. And so unless we get to a point where we think that we can't get the kind of cooperation and investment in addressing the problem that we need, then we would not be inclined to seek a Superfund listing on that site. So I'll be very satisfying, but that's where we're at on that.
It's really good to hear that you're looking to push a little more in the next few weeks, because I'm sure you heard quite a lot from private well owners, right, in the last couple of meetings, which I didn't have a chance to log into and see how it went, but I did hear it from many, many people. So thanks for, it's time to push. It's definitely time to push. Thank you.
Well, thank you for your thoughts on this. I appreciate it.
All right, thank you, Lorraine. Erin, do you want to go ahead and ask Wendy Thomas's question?
Yes, Wendy has two questions. I think one of them actually was asked by Councilor Murphy, but I'll go ahead and start with the first one, and then I will reiterate the second one. So her first question, give me a second. I have to roll back up. So Wendy's saying our well has been contaminated with PFAS for over 5 years. We have been on bottled water for the last 2 years with absolutely no end in sight. Can DES give me a definitive time frame for when my family will have clean, safe water in our house?
So, Wendy, thank you for your question. So, that's a specific question relative to your particular location. And I don't know specifically where you are. What I can tell you is that we do have, we're working with St. Gobain and communicating with St. Gobain right now, looking at locations where, for lack of a better term, we're calling low-hanging fruit, where basically we know we have exceedances in private drinking water wells, and we know that there are water lines very close by that could, in some cases, even right out in the front of the street, in front of the home, where a connection could be made promptly without really any lead time for design work, or a very small extension of a water line could be done with relatively little engineering work, and get a number of people connected. We have implored St. Gobain to give us that. We understand that they are going to be speaking about that topic with us in the coming weeks, and that the expectation, what they've told us, is that for those types of situations, they see putting some shovels in the ground this year on that. So that's encouraging. Larger projects, they're going to take a more engineered design for an expansion of a water line. They're completing their sampling so that they can make appropriate design decisions. And our expectation is that we will go to design in 2022 in hopes that we could get some construction started perhaps in late 2022 or maybe early 2022. And then, we'll see what that plan looks like. I don't know exactly what that schedule is going to look like, but I think what I've just described to you is probably a fair representation of how we would expect this to unfold.
Did Wendy have a second question, Erin?
Yeah, sorry, I was waiting for her to speak. Yes, Wendy's second question, and like I said, I think when this was asked was going back to funding, why did the taxpayers, and it was said it was taxpayers' money, have to pay for the damages that a private company has done?
Yeah, I'm just not sure I'm not sure there's anything I can say that's going to be particularly satisfying there. I mean, the way that this project has unfolded has meant that there are some people outside the consent decree boundary where we're not in a position to press St. Gobain to provide the remedy or the assistance. And we're working very hard in the ways that we've described earlier in this meeting to try to make sure that those folks get the help that they need.
All right. Thank you, Wendy, for your questions. Next, we have Representative Boyd.
Hi, can you hear me?
Yes, we can.
Okay, good evening, and thanks folks for being here for the last 3 hours. I really appreciate it, and appreciate the information that's been presented tonight. I actually just kind of want to pivot and put Dr. Ali on the spot if I could. Back in February of 2016, DHHS embarked on a limited community assessment exposure program where they tested 218 MVD users using blood serum to look at different things as impacted by PFAS. Subsequent to that testing in January of 18, there was a cancer incident report that was issued by Department of Health and Human Services. that talked about Merrimack as it relates to quote unquote different types of cancers in the community and whether or not there was the potential of a cluster. My question to you is, has there been any discussion of bringing forth a second cancer incident report that amplifies the report that was issued by 2018?
All right, thank you for your question. So I'm going to start with the second question.
Do your knowledge.
Okay, so I'm going to start with the second question, and then I'll go back to that first question about blood testing. So regarding the cancer incidence report, that would be something that DHHS would know if they're planning to put that together. I can reach out to them on that. They don't really have enough data at this point to do a full update like what they had historically. So we could still follow up with them and see if they're planning on doing that. One of the things I always try to warn people about is those cancer incidence reports and the way that cancer data is collected by the state is not done in a way to link it to environmental factors or environmental sources of carcinogens. The data is simply not collected that way, so we can't make linkages like that. The intention of those registries, or the cancer registry that the state has, is to inform what communities need resources to address certain cancers that are prevalent there. Now, that can be a little confusing sometimes, but again, it's not designed to identify linkages to the environment. So there is some limited utility in using those reports that way. So again, it would be DHHS and their Department of Health Services to actually go through and do that report.
And I agree with you on that.
Yeah, and I do believe that the Legislative Commission that's looking at this issue have those requests. So if you want to follow up with them, I can also follow up and see if they're going to be doing anything and let you know, or have it relayed to you at the commission through Katie Bush, who's their designee.
I guess maybe whoever the contact is at HHS would be helpful, and I can follow up on my end. There's no need to tax your time with that.
Okay, I can also throw that information in the chat box in just a second. So once I answer the other half of your question, I'll zip that over to Erin and she can throw that in.
Okay, thank you, Doctor.
So the second part was DHHS did do some blood testing a while back in the area. Right. They tried to get as much data as they could. They did put out a report on what they found. They did find that the residents that they were able to test on average had higher blood concentrations, specifically for PFOA. So we do know that there was exposure going on, and that's likely related to water. Now, what is happening right now is DHHS has retained those samples for a certain amount of time, and it is coming up to the point where they did agree to destroy those samples, and that was part of the written consent given to the people at that time when they collected the blood sample. They have issued letters out to those residents who had their blood sampled in that period, requesting permission to retain those samples. So this is my little plug for DHHS right now. If you took part in that blood sampling effort several years ago through DHHS and received a letter, please read the letter and get back to them. If you have not received a letter but you took part, you can either contact me, or you can contact DHHS, or you can contact Nancy Murphy or any of your representatives, and we can try to get you connected back to them. They're seeking permission to retain those samples into the future. If they do not receive consent, they will have to destroy those samples. So if you were part of that original blood testing, you haven't received a letter, please reach out. If you know someone that was a part of that sampling, check in with them, see if they received that letter. They want to make sure they get that in a timely fashion so they don't destroy anyone's sample simply because that person didn't get notified.
I guess the quick follow-up would be, has there been any responses to the outreach regarding retaining those samples?
I don't know at this time. I would have to follow up with Katie Bush and her team to see what's been going on with that, and hopefully she'll have an update at the next commission meeting.
Okay, good deal. Thank you.
No problem.
Thank you, Representative Boyd. So next is Kristen Ayers. You have another question?
Yes. Hi, can you hear me?
We can.
Okay, thanks. All right, so perfect segue, Bill. My question is right up the same alley. My question was, is DHHS still involved in this, and where are they tonight?
Still involved in what exactly?
In this PFAS, where's their update?
I'm not sure I understand what you're asking.
So I think I can chime in really quick on that.
Okay.
So
I have some questions for them, that's why.
okay, so right now, a lot of the PFAS activities for DHHS are being sort of given over to some of our roles with our Apple Tree program. I know it was a one-slide presentation that I had earlier, but that is a partnership between our program at DES for environmental health and the team over at DPHS within the Department of Health and Human Services. So we are trying to share some of this responsibility information sharing. So if there's a question I can't answer, I'd love to be able to take that back to them and we can try to get some of that information for you. But also the planning of this, the meeting was more focused on the investigation issues that were going on. And that's why we had the team here today. So we didn't necessarily plan on having them, but I'd be happy to relay any questions or try to help you if I can.
Okay, it's a little frustrating if these questions do come up. So my specific question is, regarding now that we finally have access to blood testing, which I do want to correct you, Dr. Ali. You mentioned to Bill's, you said to Bill that they tried to get as much data as they could with the blood testing. We call it in town the Lucky 200. We were begging people to take our blood. I just want you to know that, just so you're aware. We had people lining up to give blood, whereas I know in Pease it was a struggle to get people. Here in Merrimack, we begged to have our blood tested. I just want you to understand that. We are a community that was very willing to have our blood tested. So I just want you to understand that, where we're coming from. You as just to have that context. Just please, we call it the Lucky 200. So, or I think you got 217 data points. But anyway, so now that we as a community finally have access to blood testing, which I think, Councilor Murphy now is up next. She can speak to how that all came down. But so now that we finally have access to blood testing, is DHHS going to be able to have any type of registry for people to voluntarily have, any type of data as far as like people with levels of PFAS in their blood and vaccine failure, particularly with like levels of PFBA, which is in Merrimack water. So, with the COVID vaccine, there is science showing that there is vaccine failure with PFBA. So do you know if DHHS has any idea of this, and is there any talk of that being, on the radar?
So as far as developing a registry, I'm unaware of them having any discussions of doing that. They are not funded for that. That would be something that would take specific funding to start up a registry and have staff to manage that. And at this time, they are not funded to do that. And there's no discussions from the legislature, at least, of directing funding for them to look into that. As far as the recent study that came out in the last year, I believe from Philip Grandjean, that was looking at COVID exposure and PFBA, they weren't looking at COVID vaccine. So unless there's a more recent study that's come out that actually looked at PFBA and vaccines, the COVID vaccine itself, I'm unaware of that. I know that they did have a study looking at basically severity of hospital condition or hospital situation for COVID patients as it related to certain blood PFAS, and they did find an association with PFBA, but they also had some issues with controlling for issues, and they stated that they don't think PFBA is present in any medical equipment, which there is some debate about that and if that maybe complicated the study. We have had that discussion with the staff at DHHS. That is one of the roles that Mary Buta, who's helping out right now, so thank you, Mary, for all your help. We have been trying to keep track of these studies, and if there is something that's urgent, we are trying to bring that to attention of with people within DES and at DHHS.
Okay, so as far as you're aware, there's no plan to use us as any type of data for future.
No, not at this time, because it's hard to get those kind of grants to do that scale of study.
All right, thanks.
Okay, thank you.
All right, thank you, Kristen. I apologize. I heard your question as DES instead of DHHS. All right, so moving on, we have Councilor Murphy.
Great, thank you. John just made the announcement that I was going to about the blood testing. So I don't need to say it. It was about the MVD community exposure assessment testing. I know we're running near the end of the date for that, and I just wanted to make sure that people had a reminder. One question I had was, can you tell us how many people are on this are attending tonight? I'm just curious about our Merrimack attendance. Anybody have a sense of?
Yeah, so there was 89 registrants, and there was just a little more than 60 people that attended tonight.
Okay, great, thank you. And then a couple of comments. I wanted to, Representative Boyd raised a question about the CIR, and I wanted to tell him that in the SB 85, that's the Environmentally Triggered Chronic Illness Commission, we are working on just the thing that he was talking about. And as John said, Katie is a huge part. We're looking at, certainly the all the PFAS impacts that we see associated in the in the C8 study, and looking at what information that we're trying to gather, because we're certainly concerned, about our pediatric cancer, right? We, being number one in the nation is not something that we should be aspiring to. Anyway, so that I think that a lot of the SB 85 commission work will be helpful to Representative Boyd's question. The other thing that I wanted to raise and maybe mention, we haven't had a commission meeting for the either 780, 737 or 85 in a few weeks. But one of the things that happened in 2019 was the biomonitoring trace study. And that I know did involve some Merrimack residents who I actually got picked myself. So which we, as Kristen mentioned before, there was like the lucky 217 that won the golden lottery ticket for that MVD exposure assessment. I think this, if I'm not mistaken, was like 435 people throughout the state that are participating in the biomonitoring trace study. And originally the testing started, it was the water, it was blood and urine. And I know there was testing for PFAS. That happened in I think it was the summer 2019, and we were told we'd have results soon. And I guess now finally the results ran. I know that maybe at the conference last week, I don't know if there was discussion about that, but I think that will also provide some information that, for this community, because I know at least 7 people from Merrimack that were part of that. I don't know if that's something that you have information that can be shared at this point, or is it not public yet, or?
So I can chime in on that. So that, again, that's work that DPHS is doing. I know they haven't fully finalized their report. They have gotten out and done some limited presentations. I believe they're planning to set up something for the legislative commissions. If the commission is interested in doing something with that, maybe we could set up a GoToWebinar and find some way to record that. That way it can be shared better. But I think that would be something to reach out to Katie Bush about at the next legislative commission on what her team's been doing on that report.
Yeah, we've been asking, and she said there was actually a 40-page. We're going to have it bound. It was a couple of weeks ago when they thought that by the DES drinking water conference that it would be ready. I know the participants haven't been notified yet, but I'm hopeful that there will be some additional information. I know people have raised questions about data collection, and I think that may provide some. I'm looking forward to seeing that to see what information it provides. So looking forward to it. But okay, thank you very much.
Thank you, Councilor Murphy. All right, we have one more in the queue, so I just want to give a reminder that if you have another question or you have your first question, please go ahead and type your name, your full name, and your town into the question box to get on the list. So we'll move to Dave Gargo.
Hi, folks. I'm here with a friend of mine, Jamie Rossi, as well. I just want to first thank everyone for the the presentation that you've done, and I've been at a number of these going back to about 5 years ago when this whole incident kind of first started. So I know that there's been a lot of focus on all this, and been multiple people trying to get this issue resolved, organizations. So can't thank you guys enough for all that hard work, but definitely have some questions. And this is actually the first time that I've actually kind of put myself out there to ask some of these questions, but I figured now might be a good time. I guess the first question I had, there was some mention of this a little bit earlier, but is there a map? I know that there's been a lot of focus on well water and providing bottled water for the folks where their wells have been contaminated. But for the general population of Merrimack that are on public water, how do folks know if they're drinking water that is contaminated above the levels that are deemed acceptable? Is there a map of some sort that will tell me based on where I live in Merrimack, am I drinking contaminated water?
Jeff, do you want to try that one?
Yeah, it sounds like you're asking about within the Merrimack Village District system, and maybe the sampling that Don Provencher mentioned might address that. I don't know if we still have Don available. If you could jump in, or I don't know, Brandon, do you know if those data are available online?
Yeah, I would definitely contact the MVD, and they can share with you the distribution sampling they did, as well as the mapping location. You know, they also have the well data online, but it looks like you actually want the distribution samples that Don Provencher talked about. So I would recommend following up with him.
Yeah, I'm looking for kind of, really a map that will show like what the contamination levels are on the map within the public water system. So you're saying contact MVD, try to get that?
Yes, because they actually went out into the system, it sounds like, and collected those type of samples.
And then in this a little bit earlier as well, in terms of the notification to residents. So one of the things, I asked that same question earlier, like how many folks are on this call? And I was actually surprised that, I was told 72. That's a really low number for something that's been something as important as this that's been going on for 5 years. And I guess my concern would be that there are probably a whole bunch of people that have no idea this is going on. And I haven't seen anything that came out, to my household saying, hey, by the way, if you're drinking your water, you're being exposed to PFOA at this level. Is MVD doing any type of notification like that to let folks know what they're being exposed to?
I can answer that if you want. This is Don Provencher.
Yep.
All right, great. Thanks, Dave, for checking in. Those are very good questions. MVD did send out a mailer when the MCLs, maximum contaminant levels for PFOA in particular, were lowered to 12 parts per trillion in June 2019. MVD did send out a mailer to all our customers just to inform them that the water in the distribution system is typically above 12 parts per trillion throughout, essentially at that time, it was throughout the entire distribution system. So we advised our customers that we are making efforts to install treatment systems. We had some warrant articles approved earlier that year to treat the rest of our wells that are not covered in the settlement agreement with St. Gobain. And we advised our customers that in the interim, before all our wells are treated, which is targeted for the end of the summer of 2022, we advised our customers that if they were concerned in the interim, that installing in-house filtration or providing bottled water for themselves would be a good idea if that was a concern to them. But technically, the way the MCLs were rolled out is that we were required to sample our wells for quarterly for a year and then to construct treatment systems. So we're already ahead of that. So there was a mailer that was sent out. Obviously, if you didn't get it, or for some reason or another, I don't know why that is, but that mailer did go out. And to your other question about a map of the distribution system and what the concentrations are, we don't actually have a map that shows the different concentrations that were detected in the distribution system. But I do believe that information is online on the MVD website, and that's mvdwater.org. And if you look on there, I believe we do have the results of the distribution system. If we don't, I can get that to you. If you want to email me, my email address is don.provencher, that's PROVENCHER, @mvdwater.org. And the thing is the concentrations change in the distribution system depending on which wells are being used more than others. And that changes on a routine basis. So right now, as I said before, wells 4 and 5 are being treated. So they tend to supply water more towards the northeast corner of the town. The 4 other wells we have online right now supply water more towards the central and sort of western, southern portions of the distribution system. And as Brandon presented the graphs of the PFOA concentrations, all of our other wells are above the 12 part per trillion PFOA MCL currently. Well 2 hovers right around that level, but the other wells 7 and 8 and well 3 are consistently above that 12 limit. So if you want to email me on that, I can kind of point you to where you can find the test results in the distribution system. But we haven't mapped anything, and it's really not worth mapping because that changes sort of on a periodic basis depending on which wells are being used more and less. So hopefully that helps answer your question a little bit.
Yeah, it does. I mean, I understand just based on talking with someone a while back about the whole notion of a blended rate and depending on what wells are being sourced from. So I think really what it comes down to as a resident is just like, how do I know when the water is safe to drink? And what should I be doing in the interim? And honestly, like when I first became aware of this, and it was some time ago, I cut to bottled water, even though I'm not on a well that's contaminated, many years ago. And I've been drinking primarily bottled water for quite some time. And I wonder how many other residents are kind of doing the same thing, just to, better to be safe than sorry type thing. It does kind of like point to kind of, obviously, we have St. Gobain in Merrimack, and one of the things around that, in terms of, I know there's all these legalities and things like that the town's going through to try to get St. Gobain to pay whatever for what the expenses are. But I think that there's probably a whole lot of expenses that are going out the door for residents where they're either paying for their own filtration systems or they're paying for water. And and this has been going on for many years. So I don't know if there's anything that the town or maybe St. Gobain can offer up, or, in terms of any compensation for all of the expenses that individuals and the town is incurring as a result of this. I'll just table that for a second, but one of the other big questions that I have is in terms of just where are we today in terms of the pollution levels that are coming from the St. Gobain plant? Are they, even today, still polluting at levels that are above, the state regulation?
So Kathy, do you want to address that, or?
Well, I guess that need clarification of the question. Are you asking, is water leaving St. Gobain's property at higher levels and contaminating water samples, or are you talking about air emissions coming out of the stacks?
I guess it would be both. Especially, I think that I'm thinking that the ground level contamination is probably because this stuff's a forever chemical, and it's even that all those contaminants are there, without digging up all the everything around that. It's hard to like mitigate that, but I guess it would be both, like both the air and ground level contamination. Are we still being exposed to contamination above regulation 5 years after finding the problem?
So I can address the air side of that. So St. Gobain's PFOA emissions were significantly reduced in 2006 when they reformulated their raw materials. And so the air inhalation standards are being met because the emissions of PFOA are significantly lower than they were before. In terms of, are there still PFOA emissions coming from the facility? According to the 2018 stack test, there is a very low amount of PFOA coming from the stacks, but because of the contamination in the groundwater, just that amount is too much to not be detectable. We're not even looking at the standards themselves of 12 parts per trillion. We're looking at, would it be detected in a water sample coming from the facility? And that's why we're making them controls. But have they reformulated other PFAS compounds? Yes, but there are no standards for many of those. But in terms of PFOA emissions, those have significantly been reduced from the air emissions.
So it sounds like what you're saying is that the state has come up with regulations for PFOA, so the facility has shifted to other contaminants, that are not regulated yet, so that they can continue operation, using unregulated contaminants.
Well, yes, I guess in some ways you could say that. The reality is that the information that would allow us to set standards, and that's not my expertise, but there's not enough information to know whether those new contaminants would be a health issue. I guess I should really defer to John on how to explain that better. But
yeah, and I can just jump in with that. This is a problem that we have with not just PFAS as a class, but with a lot of other chemicals in industry use, is for us to develop a health-based standard to enforce, we need information to know how much of it poses a risk. And for several of these PFAS compounds, we do not have that data. We have enough for some of them, and that's the ones we've either set standards for, those that we're looking into. But if there's other chemistries that have come out and it's something on the market with no data behind it, we can't set a standard for it. And it's hard for us as an agency to be focusing on the cleanup end of it when these are things that come out in broader industry that are used worldwide. So that's a challenge for our own program, but I guess I'd also leave it to Mike Wimsatt to chime in for other issues as far as regulating these novel compounds.
Wow. Yeah, I mean, this is a big question, and it goes beyond, like, why are we in a position where companies can introduce manufacturing processes in a residential environment where it's on community to prove that they are doing us harm? Why aren't they on to prove that they are not harming us?
Yeah, this is Mike. So that's a legal and a philosophical question that I think is far beyond the scope of this meeting, and I don't think that anybody else is going to be satisfying for that. So I think we're going to pass on that one. Back to a previous question about the site itself, the site proper. In the context of the significant and massive impacts on drinking water and groundwater over tens of square miles, that impact, those air emissions and their impacts on drinking water are the real story here and the real challenge that we have. To be fair and to be sure, though, the site is significantly contaminated probably through air emissions as well as conventional releases. The site investigation for that is continuing, and we will no doubt be looking at a robust effort to address localized impacts to groundwater and soil on that site. But to be fair, and that's entirely appropriate to do so, and we expect to do that, but it's also important to understand that that is not going to have any meaningful impact on the widespread impacts on drinking water quality. So, that's why we're spending so much time working. Really, it doesn't feel like it to folks, but we've been working feverishly for 5 years on this, trying to get people figure out where the exposures are happening and trying to get them addressed. But simultaneously and in parallel, Jeff Martz and his colleagues have been advancing that site investigation, requiring St. Gobain to look at their site proper, and that will eventually culminate in some, what I imagine will be some robust efforts to address soil and groundwater contamination.
Mm-hmm. And just to be clear, in 2006, they reformulated to get rid of PFOA because of an air inhalation standard that existed. Now they're proposing on controls, which would, regardless of whether there's a standard or not, be able to destroy compounds. So the intent is that the best available control technology will build these new compounds as well as the legacy ones.
Right.
Okay. Thank you. Thank you, Dave. Do you have any other questions?
Well, I guess the only other question I have, and maybe a little a suggestion would be, and it might be, I know that we're planning like sometime, like third quarter of 2020. Like we're expecting that the system will be mitigated, will be within range around that time frame. If folks are looking to, put on like filtration systems and things like that, is there anything? I'm wondering if the MBD, if there might be an opportunity to just make it easy for residents to just maybe come down there and say, hey, I'm going to put something on my water system at the faucet level, perhaps maybe having those on hand at that location where you can just go there and say, grab it right there and, forget about the cost, but just make it easy for residents comfortably know that they're picking the right system that's going to work for this particular area. I don't know if that's a question for Dawn, if that's something that we've looked at.
Yeah, Dave, that's something that we haven't looked at. I don't think MBD is going to get in the situation where we're recommending in-home filters or anything like that. I mean, we're addressing this at the source level. We're talking anywhere between 2.5 to 5 million gallons a day of water, and to provide treatment for people's homes or recommend treatment for people's homes is something that's just, I don't think that the resources of MBD could handle something like that. But we did notify, like I said, that there was an issue with the levels of PFAS in the water. And I think, it's up to the customers to determine if they want to take action over the next, year and a half or so, or hopefully less, before all of the water is eventually treated. So I think by addressing it the way we are, the voters actually approved to put the treatment on the additional wells. I think that's what MBD is moving along to do. And I think trying to do anything more is just probably beyond the scope of what MBD is capable of doing, unfortunately.
Okay. I think I'm all set for my questions, but I have a friend of mine here, Jamie. And Jamie, do you have a question?
Jamie Rossi in Merrimack also. I was just hoping to make a suggestion to MVD, and that would be to go ahead and include a quarterly update with the quarterly bills about the current levels and the current progress on the production of the mitigation systems.
Okay, that sounds good.
Thank you.
Okay, thank you, Dave. In the interest of time, we're going to move to the next person in the line, but if you do have some specific questions related to the operation, testing, or sampling results from MVD, you can direct them to Don, and his email is in the chat if you need to have access to that. All right, so we're going to move to the next person in the queue, and that is going to be Commissioner Von Schoen.
Good evening, can you hear me?
Yes, we can.
Good. So first of all, thanks everybody for spending this much time here tonight. I'm going to keep it real short. I wanted to address briefly two things. Dave Gargone had mentioned that MBD could be possibly providing or offering services to install filtration systems for individuals that are looking to have point-of-use filtration systems. I do actually believe we discussed this in one of the board meetings about 2 years ago, and have decided against it, like Don said. And the reason really is that there's different technology and different vendors out there at different price points and, different levels of filtration systems and qualities. And MVD was not comfortable making that choice for the customer. So I just wanted to share that. I'm pretty sure that MVD discussed that in one of the board meetings and was pretty proactive about it, but decided for those reasons not to do that. In regard to the question about adding these, the concentration as concentration system being measured on a frequent basis, a lot of people still don't realize in town that MBD has added an email newsletter as well as a Facebook page over the last 2 years. that customers can subscribe to, and even actually anybody really can, not just customers, and be kept informed about recent events, any kind of construction work, any construction updates, any sampling results, any breakages that may have happened in town or may are happening right now in town, any service interruptions, or also the flushing schedule is also part of that distribution of updates. So highly recommend that anyone interested in being more informed about what's going on at MVD, visit the website, again, www.mvdwater.org, and subscribe to the newsletter, and also possibly look on social media to subscribe there. Thank you very much.
Thank you, Commissioner. Next, we have Lorraine Allen.
Very brief, and then that's that. Have you thought about using some of the newer Eurofins measurements and having Golder do that on site at St. Gobain and selectively off site? The two that come to mind is either the TOF assay for total organic fluorine, and comparing that maybe to some of the EPA, recommended tests, and see how that jives. And the other one that I'm wondering about is Eurofins has that new snazzy test. I can't think what it's called, but they can test 70 PFAS. So you can look at the legacy and the medium chain and short chain, and then get in some of those ones with the H thrown in there, that class. That H class showed up in or air sampling by the EPA, if I'm not mistaken, and that's some of the stuff that's down at Shumwars in Brunswick County in North Carolina. So I think that would just be a fabulous way to look at additional data. So I don't know if you've thought of asking them to do that. That's my question. Thanks.
Thanks. We're constantly watching new developments in lab technology, and we did partner with EPA's ORD laboratories, and they did some non-targeted analyses from samples in around the overall study area, and we do have some non-targeted results. But I appreciate the suggestions of the TOF assay, and that's something we'll certainly keep an eye on. Thank you.
All right. Did you have anything else, Lorraine? Okay, there are no other people in the queue right now. So Jim, if you could just monitor it for a few more minutes. And while we're seeing if there are any other questions, I just wanted to give a reminder that tomorrow a follow-up email will go out. And in that email is going to be a link to a Dropbox. And in that Dropbox, you will find all the handouts that were posted tonight, as well as the video recording and some additional resources as well. So that'll be available to everybody. And that will go out to everyone who attended tonight, as well as anyone who registered and was not able to attend tonight. So Jim, are there any other questions or any other people in the queue?
I don't see any. Amy, do you want me to stop sharing my screen? So do we have a contact slide that you want to share?
Yeah, I'll put up the contact slide. Thank you.
Okay, thanks.
Hold on, I just have to make myself the presenter. All right. So here is it. Can everyone see the contact screen? Just want to make sure. Okay. So this is the contact information for everybody that was on the panel tonight, and what they have expertise in. So you can reach out to any of us at any time if you have further questions that you think of at a later time. We want to thank you for joining us tonight and for hanging in there for about 3 hours. So again, I'm going to turn it over to Mike Wimsatt for some final comments.
Thank you, Amy. So I just want to thank everyone for hanging in with us here tonight. This has been a long session, but I hope that it was helpful. I hope that we got to your questions and helped you understand better. And we, I want to especially thank town officials for sort of virtually hosting us here, but also want to especially thank Commissioners Provencher and Von Schoen from the AD for making themselves available to answer questions here, because obviously there was a lot of interest in that, and it's really helpful to have them here to be experts and answer those questions. And again, thanks to our team, who this is the fourth of four public meetings that we crammed into 1 month here in 4 different towns, and these folks have worked really hard to present this material and answer your questions, and I'm very thankful and proud of all of them. And again, I want to thank all of you for staying with us, and this certainly won't be, this hasn't been the first, and it won't be the last time we come to speak to you and answer your questions, but I hope this was helpful, and please do make use of those contact names and information for your further questions. And thanks again, and have a great night.
Merrimack TV is committed to our community. From gavel-to-gavel coverage of town and school board meetings to updates on town services and projects, we aim to keep you connected.
Good morning, I'm Kyle Fox, Public Works Director for the town of Merrimack.
Hi, I'm Diane Trippett. I'm the town clerk tax collector for the town of Merrimack.
I'm Captain Matt Tarleton with the Merrimack, New Hampshire Police Department.
And keep the public informed of every motion.
All those in favor signify by saying aye. Aye.
And many moments, so you can be confident that we're here for you. Thanks for watching. Stay connected. Follow Merrimack TV on Facebook.